All right, I think we're live. Mic check 1 2 1 2. Mic check 1 2 1 2. If anyone in the chat can hear me, just push 1. I can't get out. All right, I got a confirmation. Thank you for the confirmation. Welcome back to the Black Brain Trust. This is episode 475. Please hit the like button as you come in, share the video if possible, hit that notification bell so you get all the updates from the Black Brain Trust, from those posted on the community tab. If you want to engage in this discussion, there'll be a link in the chat for you to click upon. When you click on the link, make sure you raise your hand so that one of us can acknowledge you, that links you to the panel.
They gotta stop lying to the kids, man. Feeding them that same old bullshit. You know what I mean? Regurgitated crap. It's the meaning behind the sacred symbols. The goal behind the patience that makes it simple. For me to be the creator, I had to stay consistent. Knew that it would be greater later and stay persistent. When your moves about millions, you gotta run a maze. So get the hint, no disturbances when I'm running plays. Needs and wants the strongest traits of the human nature. Disconnections from it all, some say it's elevation. But fuck that, we getting rich for my peoples who was crucified, tortured, and lynched. I'm a product of kings and queens and gods and earths and slaves anonymous. Freedom or death is what we used to shout. So why we still throwing parties inside a burning house? The devil's still trying to turn us out. History repeats what you refuse to learn about. Accept your own and do for self. This life is all about health and wealth. My 12 jewels keep me focused, and yeah, I'm on my square. Acknowledge God that's seen and heard everywhere. Accept your own and do for self. This life is all about health and wealth. My 12 jewels keep me focused, and yeah, I'm on my square. Acknowledge God that's seen and heard everywhere. I probably move to Ghana, get into politics to restore the motherland and legalize marijuana. 1 for the ancestors, 2 for the rituals, the reincarnated energy from the spiritual crossroads that seems near me. My thoughts travel like string theory, which allows me to do my thing yearly. Unorthodox artist when I started was hella critics. I went from pimping and macking to using metaphysics. I'm on some Dr. Deborah Blair shit, dropping heavy. Science, word up, I even blew trees with Dr. Sebi. And that was around the same time I was copping heavy. Couple homies fell victim that was not respected. I'm still a factor in my section, studying lessons from the essence. The wisdom is the most precious. Sajad Allahu to the ones who know the hidden face that came from the west with new wine and golden scrolls. Accept your own and do for self. This life is all about health and wealth. My 12 jewels keep me focusing, yeah. I'm on my square, acknowledge God that's seen and heard everywhere. Accept your own and do for self. This life is all about health and wealth. My 12 jewels keep me focusing, yeah. I'm on my square, acknowledge God that's seen and heard everywhere.
All right, let me see if I can get this working because I don't know what's going on with Zoom right now. This is really weird. All right. I just want to go over this real quick. Oh, I think I know what the problem is. Okay. Okay, I think I know what the problem is. All right. I'll work with it for right now. All right, let me read this real quick and hopefully Dr. Phoenix steps in. This is from AlJazeera.com. This was posted 14 hours ago. Fresh details emerge about Nigeria's first coronavirus case. An Italian man who has been confirmed to be Nigeria's first coronavirus case after arriving from Milan was in the country for almost 2 full days before being isolated, traveling through Lagos and visiting another state. The case has prompted a scramble by authorities in Africa's most populous country, who are now trying to trace everyone who have arrived on the same flight as the patient and identify the places he visited before going to the hospital. We have started working to identify all the contacts of the person since he entered Nigeria, and even those who were with him on the aircraft. Health Minister Osagi Enari told reporters on Friday in Nigeria's capital, Abuja. The Italian, whose country is the worst hit in Europe by the coronavirus outbreak, arrived on February 24th on a Turkish Airlines flight that had a connection in Istanbul. Akin Abiani, Lagos State Commissioner for Health, told reporters. After spending the night in a hotel near the airport, he arrived in the neighboring state of Ogun, on February 25th at his place of work. He stayed there until, sorry, until he developed a fever and body aches on the afternoon of February 26th. Abiani says. Health practitioners with his company then contacted biosecurity authorities who transferred him to a containment facility in Yaba, Lagos State. It was very astute of the medical practitioners in that facility to keep him overnight in an isolated environment. And Ari said the infection was confirmed on February 27th by the virology laboratory of Lagos University Teaching Hospital, part of the laboratory network of the Nigeria Center for Disease Control. And that man is now quarantined but doing well. As well as being the first in Nigeria, the patient is the first confirmed coronavirus case in sub-Saharan Africa. Turkish Airlines did not immediately comment on the case. There are no confirmed cases in Turkey. The World Health Organization has said it already has experts on the ground in Nigeria, which it identified as one of 13 high priority countries in Africa. In a sign of mounting concerns in Kenya, the country temporarily suspended flights from China on Friday. Kenya has no confirmed cases of the virus. So, I find this image really, really interesting because you go through the airports now, even, on different international airports, they have these digital thermometers that they seem to think that they can determine whether or not a person, has symptoms of a virus by shooting a laser at them. It's absurd. At least from a technological standpoint, there's no way to know, like this person made it through the airport, and no one knew what he had. So what use is that really of them to do that? So I just came back from the continent, and one of the things that they did was they had this iPad where they kind of just did some questions. Was I in China? No, my flight came from the United States. Why would you ask me that question? But they're asking all these questions, but it doesn't really seem to get to the root of the problem. And I find that to be very interesting because they're not doing real due diligence. From a cybersecurity standpoint, we isolate just about everything. We go through a remediation process and so on and so forth. And it seems like with this outbreak, no one seems to know what to do from a governmental standpoint. Everything seems to be shoot in the dark. We got Dr. Phoenix on the panel.
Hey, good evening. Good evening, brother. Good. Yeah, thank you for having me on.
Okay.
Yeah, the problem because the problem with just scanning people for their body temperatures, the reason why is not effective because even if they had a fever, for example,
mm-hmm.
it's very non-specific because there are any number of things that can give you a fever. You can get a fever because you have a bacterial infection. Yeah, you can get a fever for a number of things. So I mean, it's just it's not a very effective measure of 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 assessing whether or not an individual is sick and specifically they are a carrier of the coronavirus because the fundamental problem with tracking this virus is that people are asymptomatic for a period of time. Um, on average, has been estimated between 3 to 14 days. However, I've seen some stories and read some case studies where they were saying potentially it can be upwards of 21, almost 30 days. It really depends. And in that period, people that are asymptomatic, you'll walk through an airport, not have any symptoms, not have a fever, not have a sore throat, a cough, or anything like that. And so in that period, those people are still infectious. They can still pass the virus on to someone else. I think was it a couple days ago they were showing in Iran where I guess the gentleman, he's the prime minister or whatever he was, and he was on national TV and he was giving this speech. He was talking next to I think it was the prime minister, I can't remember, but you kind of see him on the television. He's patting his forehead. He clearly looks uncomfortable. He looks sick, and then come to find out he has the coronavirus.
Right.
And so again, when you saw him doing that, you would think, oh well, maybe he has a cold or a flu or something like that, pneumonia, or something like that. So again, the problem with the virus in of itself is that you're asymptomatic for a really kind of sort of a very hard to distinguish period of time, but also even if you are symptomatic, your symptoms are very non-specific. You can have a cold and have the same symptoms again. You can have
Mhm.
the flu and have the same symptoms, and so on and so forth. So checking somebody's temperature, because they were when this first started, when this first broke, when some of the first cases broke, and then eventually they got to talking about it here in the States. Noticed they were diverting people through the major airports, the five major airports in this country:
Mhm.
LAX, San Francisco, uh, uh, Chicago O'Hare, Atlanta Hartsfield Jackson, and New York JFK. And at those airports, they were using thermal scopes to check people's body temperatures. And even then, even doing that, it's such a terrible way to try to gauge whether or not somebody is sick.
Right.
Is really not a good way. And so just to put that into perspective in the article.
Now, wouldn't it make more sense um, if you're trying to identify whether or not people have symptoms? Wouldn't it make sense to actually document the ones who, from an airport standpoint, you ask people a couple of questions and they just say no, yes, no, yes. No one's ever going to admit that they came from Wuhan, right?
No, exactly. You're asking people to self-report.
Yeah.
That's a good point. You're really asking people to self-report. Yeah, I was in this area that's pretty infectious, where we known as the sort of the genesis of this version of the coronavirus.
Yeah.
Because again, this version of it is one of many. And again, it is, coronavirus caused SARS back in the early 2000,
Mhm.
also caused MERS, which is also known as the Middle East Respiratory Syndrome. Those two also were caused by the coronavirus as well.
Mhm.
So, but the problem is that if you're asking people to self-report on some little silly survey, well, okay, yeah, did you go here? People are never gonna tell that.
Yeah.
People, people are not gonna self-incriminate here. Especially when you're looking at a unspecified period of time where you might be in quarantine. You
Mhm.
know, people are not gonna do that. I mean, I think is a better way is actually looking more or less at their travel itineraries, because these whether it's like the TSA or anything like that, they know where you're going.
Yeah.
That's probably a better way to assess whether or not you were in a potential area where there is an endemic.
Mhm.
Instead of just asking people to self-report. But also, if you were to do that,
Mhm.
now you're looking at, let's say you had 1,000 people come back and they were all maybe in any, because right now it's pretty much the coronavirus is in every province in China. So right now we know if you went to anywhere in China, it's a high probability that you may have come in contact with some infectious person. And
Yeah.
so then they may warrant, because we don't need you to answer, we don't need you to answer some questions for that. We know that just based on looking at your itinerary, looking at your passport, all that stuff. We know where you got stamped at.
And see, my thing here is from a digital health standpoint, I would have, this is just me thinking from an IT perspective. Anybody who's coming in to an airport off of a flight from anywhere, I'm going to document all of these people. I want to do DNA swabs. I want biometric fingerprints and handprints if I can. And I want to make sure that, those people who come into our country, we've documented all of these people onto some kind of digital ledger, and we've placed them into some kind of database that says yes, no, or maybe, right? It seems to me that asking these people a few questions, that's it, self-report, they deny, they move on, and that's, they're already into the country anyways, and it's too late, right?
Well, but see, and therein lies the problem, because you have no way to track where they went while they were in whatever country they were in prior to, let's say, coming back to the U.S. So
Mhm.
you really don't have a real way to track exactly where they move throughout. They could have been anywhere in China.
Right.
So
Well, that,
this is essentially an epidemiological nightmare because it's virtually impossible to track somebody's whereabouts.
well, not even just China now. They're passing through all these various international connecting airports, right?
Yes.
They're coming in contact with all these people. When I was in Istanbul, people walking around with masks, but there was no confirmed cases. But you were in constant contact with all these hundreds, if not thousands, of people, and there's no real way to determine who has what in that area.
I don't know why they're having people wear those masks, those silly masks. I'm just going to outright say this. Those masks won't do anything.
Right. When I was,
The
yeah, when I was,
mask will not do nothing. So I mean, if you're gonna get a mask, you need something called an N95
Mhm.
mask.
What is an N95?
It's a specialized mask with a built-in HEPA filter, and it will filtrate out those particles.
Yeah.
But I think right now, someone sent me one. Someone sent it to me on earlier today on my Hangout. I guess they've been going up in price on Amazon
Yeah.
because I mean the hysteria just hitting a fever pitch now here in the States, especially given that you know uh, Donald Trump has cut the CDC and NIH budget, and now he's actually looking at cutting the NIH budget some more, and he's looking at cutting the nursing budget, the nursing education budget, actually a pretty big chunk of it.
Yeah.
So this is where we're at in this country, where this country is wide open to a potential a pandemic like the coronavirus. Because let's make no mistake about it, this is a pandemic. I
Mhm.
don't care how they report it in the media here in the States, because it's been very much downplayed here since the first cases popped up back in the early part of December of last year.
Mhm.
It's been very much downplayed in the U.S. media, and it was very clear from the beginning that there was no way, there was nothing that China could do to contain this virus. Nothing.
Mhm.
Prior prior to when they first realized what it was, by that time you had more than 5 million people who moved through the city of Wuhan and have no way of knowing, and they had no clue where those folks went beyond that Chinese lunar year.
Yeah. And see, they're not really keeping track of who went where, and there's no real DNA swabs. There's no real way to determine. Because let me ask you this: Can you, what can you get from a DNA swab? Swabbing someone's mouth and running an analysis. What can you gain from that?
Not a whole lot, other than if you're just trying to other than I mean I guess assuming you carrying remnants of the virus within in your saliva, yeah, sure, you can probably get that, but not likely,
Okay.
because given what the coronavirus attacks the respiratory system.
Okay.
So it specifically attacks the lungs. So if you want to get, if you need to get a sputum culture, meaning you need them to cough deep and spit up some of that icky stuff.
Okay.
That's what you need
Hmm.
to be able to find out. Getting a saliva swab probably won't help much in that regard.
Okay. Now, it's interesting you brought that point about the mask, because these sanitation companies are making a profit right now.
Oh no, they're making a killing, dude. Like I said, I saw the link I was sent. Was it last night? Or I think it was early day or last night from a friend. Was, oh man, I think it was going for like $300 on. I think it was Amazon. I think the link.
Oh, wow.
Yeah, for these N95 masks.
Mhm.
And again, where I'm at, I went to the store a few days ago and I just brought a couple of cases of water, and the water is flying off the store shelves like it's the end of the world, man.
Yeah.
So,
Yeah. Yeah.
I think this goes to the fact that, you know, there's no stopping the this coronavirus, people being exposed to it here in America. There was gonna never be any way of really containing the virus. Again, we know in the very early days of the virus that you already had people coming into the States. One of the first cases popped up in the US I want to say was in Washington State.
Mhm.
And that was like mid late December.
Yeah, I think Massachusetts was after.
Yeah.
I think somebody in Logan Airport actually contracted the virus. Um,
Yeah, because I mean, the idea about these, getting these masks, which I think, in all honesty, if you were to prepare for a situation like this, that would be personally what I would do. I would buy an N95 mask. That would be personally what I would do. However, the problem is this stuff is a cash cow right now for these companies.
oh, yeah.
These little flimsy, basic little surgical masks you see people wearing, that's not going to protect you because, again, coronavirus is transmitted droplet, and that's something we'll get into a little later. But just sort of the method of transmission, you're looking at droplet. So I mean, that having wearing a mask won't necessarily protect against that.
What about gloves? Because I see sterile gloves. I mean, flying off the shelves. Just
Sterile gloves won't help because you got to take them off at some point.
yeah.
And in fact, if I remember correctly, the one case out of the Seattle area, the gentleman, he was one of the first cases here in the U.S. He was treated at the University of Washington Medical Center. I think is in Seattle,
Mhm.
um, and they actually tested his stool, and they found traces of the coronavirus in his stool,
No way.
which means that which means that the potential method of transmission could potentially be a fecal oral route. There's actually some early case studies that came out last month that show that they found traces of it on doorknobs.
Yeah.
um I mean, right now we know for sure droplet is one of the confirmed vector, is one of the confirmed methods of transmission.
What is a
Potential.
droplet?
So droplet would be like someone sneezing or coughing. If you ever sneeze and
Mhm.
stuff kind of flies out of your mouth in every direction,
Mhm.
and so that would be droplet. You want to protect against that. You don't want to get sprayed with somebody's
Mhm.
saliva, bodily fluids, whatever.
Mhm.
And so that's what I mean by that. But yeah, so right now, there's a few methods of transmission possibly that that could be of of that are certainly concerning. Because again, I think if you're sterile gloves won't help in that regard. The best way you're gonna do that, people have to practice proper hand washing technique. You know, I can't stress that. I can't stress that enough. You need proper hand washing technique. Proper hand washing technique, at my opinion, at least 20 seconds under warm water, vigorously washing in between your fingers, your fingernails, all of it. You should wash up at least about um, midway up up your arm to about near your forearm. You should wash there, upwards to there, at least 20 seconds. Warm water doesn't have to be scalding hot, but at a minimum you should be washing your hands under warm running water for at least 20 seconds. And you need to do that for the most part, every time you come in contact with a solid surface, you might be in contact with people. That's something to keep in mind. That is probably the best way you'll be able to minimize your exposure to the virus. You know, I think just unless you do have one of these N95 masks and you're wearing it out in public, the optimal method right now to minimize your exposure would be proper hand washing technique.
Yeah. See, I see black people in America doing this a lot, especially the women. They're going out and they're getting these hand sanitizers and they every 5 seconds, they walk around, your hands smell like alcohol, man. What's up with that?
Well, the problem with hand sanitizers, obviously in hospitals, I've used it, use it all the time.
Mhm.
Um, the problem with it is that, again, it's only good. Hand sanitizers only work as long as your hands are not visibly soiled, meaning you don't have anything visibly on your hand. And if that's not the case, you need to be doing regular hand washing. Hand sanitizer is only effective unless you worn some gloves, and then you took them off. You don't have anything visibly on your hands. Then you can use it. Then. But if you've been touching things without a gloved hand, you need to be washing your hands in the normal method.
It's crazy out here. I see people on the buses and stuff like that, man, just, hand sanitized up and everybody's pulling it out. And it's like, you can keep touching that pole after
Yeah.
the other person touched that pole.
Yeah, that's a good point because again, they use the hand sanitizer, then you'll touch this pole that a million other people have touched on this bus or train, whatever, the same day.
Yeah,
So it's really not effective. But also too, there's a lot of studies that show that potentially the reason there are a number of you know resistant bacteria out here is because people use hand sanitizer.
right.
And so so I mean it's really it's I guess from my perspective it really is kind of somewhat exciting to kind of see this stuff happening, but in another way it's very concerning given how at least the US government has responded to it, and certainly how there certainly seems to be certain sectors of the economy that seem to be benefiting quite well off of this.
Absolutely. Absolutely. That we, something that we had covered earlier in the week. When I came back from the continent, I said everybody, one in every three people at the airport had some kind of mask on their face. They had gloves on. They hand sanitizers and or aerosol sprays. Disinfectants. What are you doing?
Do they let people go through the airport with aerosol sprays? That's kind of interesting.
No, no. These were the airport personnel.
Oh, okay,
But
okay. I mean, it really doesn't help because again, you touch those dirty metal detecting ones. I mean, you put your hands on all kinds of surfaces. I mean, think about when they're operating those X-ray machines or whatever. You know, I'm sure those things are like a bacteria. They're petri dish of bacteria.
oh yeah, take your shoes off, take your belt off, go out there barefoot, go ahead. It's current. It does not seem, I can understand African governments and agencies not being prepared for this. It doesn't seem like the United States is even prepared for this. It just seems like they kind of are shooting this in the dark. And I wonder about Black people because they tend to be in isolated areas for the most part when it comes to their living state, right? Their segregation kind of keeps them isolated, but they tend to live in a way that makes it easy for the virus to transfer. Is that making sense to you?
No, and no, you're right, and I think part of the problem is that simply, um, part of the problem is that simply, I think that the hysteria out here is just kind of really heavy because again, here in the States, I mean, the underreporting of the coronavirus has been pretty systemic. And so again, you're seeing people kind of instituting, I wouldn't call them extreme measures. I would call them really just ineffective measures.
Mm-hmm.
And I think a lot of it's just a response to the fact that you have not seen a cohesive response from the US government. And certainly since Donald Trump instituted this task force that's headed up by Mike Pence, there was a story that came out, I want to say yesterday, where I think this guy is the director of the Institute for Allergy and Allergy and Immunology, one of the institutes of the NIH. I guess he was supposed to go on a number of shows, I think yesterday, and since Mike Pence came to run this Corona task force or whatever, I guess he got snatched off of these appearances he was supposed to have on these various shows yesterday.
Oh.
So I mean, I think a lot of what's going on here is that the coronavirus, um, while the issues are very are singularly uh, uh, while the issue around it is important, however, I do think the the greatest burden of mortality from this virus is really going to be for older people. So younger people will probably, if they do get it, they would just probably have more flu-like symptoms. They wouldn't probably lead to anything that would maybe require hospitalization, which means that what I'm getting at here is that while it's a very concerning virus and concerning in the way that the U.S. has responded to it, however, I think a good majority of people are not going to be affected as the way we think it is. But however, you got folks using the hysteria to benefit financially from it.
Yeah, a lot of pandemonium. Um, but the point that I was bringing up earlier was that the way Black people live, man, the unsanitary environment that they do have makes it an easy transfer method for this. And I would have thought that there would have been more emphasis put behind, you know, Black people, just an awareness campaign for Black people, like, don't be giving dap to this cat right here, man. And things of that nature, kids in school, man, who go on these field trips and whatnot, man. It's just so easily transferable now to them because they're so at risk because they don't have access to at least immediate healthcare, right? They're using the emergency room, but the emergency rooms are backed up right now. So if someone was to come down with those symptoms, they could be waiting 24 hours in the ER and not be seen.
Well, yeah, I think the problem is that this virus, how this virus kills, is really related to the fact that it attacks the respiratory system, and specifically, it causes a condition known as acute respiratory distress syndrome, or ARDS for short. And essentially, what that is similar to what pneumonia does, where pneumonia causes inflammation in the lower, tends to cause inflammation in the lower lobe of the lungs. Ours actually causes inflammation all of the lung. So not confined to one specific area of the lung, but the entire lung.
Wow.
And that's how it kills. And so and people are more susceptible to this, obviously, if you're older, if you already have respiratory issues. I haven't really seen any cases of children getting the coronavirus, and certainly um, at least some theories out there seem to support that maybe children for some reason or another have some form of resistance to it. Don't know exactly why that may be.
Yeah.
But as a whole, it would appear that children are not, at least at surface value, are not being exposed to the virus, or if they are, they seem to have some form of resistance to it. But this virus is right now is looking like it's deadlier for people 50 and older, and people who already have existing conditions like maybe diabetes, um, some type of respiratory condition, maybe high blood pressure, something like that.
Mm-hmm. Mm-hmm. We know that Black men are, one of the leading cases of type 2 diabetes and
It's interesting you say Black men, because I think this is more relatable to men in general.
Mm-hmm.
But at least some of the case studies that were coming out of China over the last month and a half or so seem to suggest that that the virus tends to have a higher mortality for men.
Right.
And which, that's kind of ironic. I'm not entirely sure as to why that's the reason. Maybe it could be that maybe men in China tend to smoke more than women, maybe, perhaps. But with that said, it at least seems to suggest, at least anecdotally, that men tend to have a higher, men have a higher mortality and may be more susceptible to those complications of the coronavirus.
Yeah, I would have thought it would have been attributed to the pollution factor in that environment as well. Because, I know for a great period of time, pollution was breaking down. It was causing a lot of respiratory issues in China. And then compound that with this new pandemic, it makes it that much more susceptible to men to actually have it. Because to your point, they smoke cigarettes more. So there, varying compounding issues that could be attributed to this. But I'm making the case for Black men because they already have, some of these symptoms, that would be an enabler for accelerating this sort of issue. And so they find themselves in the crosshairs, lack of proper access to healthcare previously, and now you compound that with, a new outbreak, and they're like, yeah, this is like World War Z.
Yeah, I think lack of access is certainly a concerning issue as it relates to the coronavirus, especially for older Black men. Um, certainly a concerning issue. I'll also say too, just in general, if you've been a smoker, if you have some existing respiratory condition, because we know, many Black folks tend to have asthma or bronchitis or something, some reactive airway disease, that that can be an issue, even for children, potentially even for children, because children have tend to have, Black children tend to be very susceptible to reactive airway diseases like asthma and such like that. So, but certainly the early data seems to suggest that men are more susceptible, older men specifically are more susceptible than other groups within the population to the coronavirus.
Mhm. One of the things that I've been on alert for, I work in big pharma for those you don't know, and we have to look out for counterfeit drugs being prescribed in, on the black market, being sold as a branded drug, as a solution to coronavirus. So we've been on the lookout for those type of things throughout the week, kind of scouring the deep web and stuff like that. So it's an interesting time for all this to come about because the continent does not have the infrastructure to handle this at all. They're not even prepared for this. So I'm not even going to go into that. That's been long understood, even with the Ebola outbreak. But in the United States, you have a lot of opioid users staggering around, needles everywhere. You know, would you be able to elaborate on someone who is on these sort of transferring of needles and things like that? How you know how how likely is it that they can come in contact with something like this?
I'm sorry, brother. You broke up a bit. I didn't quite hear that.
With all the opioid use being done in the urban cities in America,
Mm-hmm.
how susceptible are the users of intravenous drug use and their unstable conditions when it comes to the coronavirus?
I think in general, anyone that has anything that compromises your total body health,
Mhm.
so will ultimately be more susceptible. So, if you're intravenous drug user, if you're sick, if you have diabetes, again, your body is already fighting one condition, you know, then to then to get exposed to, let's say, the coronavirus, again, now your body has to fight that and quarantine that, and neutralize that threat as well. So I think anything that takes away your body's resources to fight off disease ultimately puts you at a higher risk for developing complications related to the coronavirus.
Hmm.
So, as it pertains to the IV, opioid drug users, certainly, I would certainly say certainly a possibility where they could potentially be at higher risk. I mean, certainly if they're sharing needles, maybe they might have hepatitis or something like that. I would not, I would think that they may be at a higher risk just based on lifestyle alone.
Right, right. Now, have not saying where you work at, but have you gone through any training in the last maybe 14 days, 30 days or so on what about this whole entire thing? Like, what did they?
You know,
Bring?
it's funny. I say yes and no, and I think I, I mean, yes, because it would appear that health systems across the country are sort of quietly have been quietly preparing for the eventual fact that you would start to see cases of the coronavirus here in the U.S. Yes, but has it been a top priority? I would say no.
Mhm.
In regards to me, yeah, I mean, yeah, I've gotten I've gotten some some virology classes and stuff like that. You know, I've gone through some other training and stuff like that. Most of it is just really about minimizing risk and exposure. But I would say for the most part, at least for me, not so much so. And a lot of it is also too because also in school, so we got a whole bunch of other stuff going on as well. So I'm not necessarily seeing folks like that per se, not as heavily. But um, but yeah, if that answers your question.
Yeah, yeah, that definitely answers it.
I do want to add one thing though.
Mhm.
I do want to add one thing because again, this country has about 100,000 or so ICU beds. People who eventually develop complications from the coronavirus ultimately end up in the ICU. Again, and the reason why what we was talking about earlier with the questionnaire and thinking people are going to self-report and going to self-quarantine and all that, why that's silly, is the fact that they're not going to do it. But also too, hospitals are much better equipped to isolate patients with coronavirus. They're
Right.
much better equipped and far more effective at it. So again, but if you were, let's just say theoretically, you got, I don't know, let's say you got 10 million people infected with the coronavirus theoretically, and out of that 10 million, let's just say if you're looking at maybe in 10% of that 10 million, the coronavirus may cause those people to develop acute respiratory distress syndrome. So let's just say, uh, well, no, let's make this number a little simple. Make it a million people got it, and let's just say 10% of them got, which would be about 100,000, got developed acute respiratory distress syndrome. Um, Now you got about 100,000 people that need to go into the ICU. So now, if you only have roughly about 100,000 or so ICU beds in this country, now you're at maximum capacity. So if you start to get more infected people, and they eventually go into ARDS, now you're going to need more hospital beds. Again, the problem in China, what you saw in China with them building that hospital and really in record time, was that you had so many people getting sick that you didn't have enough beds.
I saw how long the lines were. The lines were going for at least 10 to 12 blocks. And so you were waiting out there for quite some time, and they were turning these people away to different districts and whatnot. And, I'm not sure how much anxiety may trigger or accelerate the process, but um, if you did have the symptoms and you're looking for help and you had to sit and stand in that line, man, you were going to be there for a good 22 hours at best. And you probably must be quicker to drive 4 hours to another location. It's just one of those things. Not to say that the Chinese government didn't do a good job at managing this. I don't think that's neither here nor there for me to say, but I just think that when we look at this from the United States standpoint, we think about HIV and CDC being in Atlanta and whatnot. I just find it interesting that there's no there's no real way to track infected people in this country. At least to my knowledge, there's no real way to really track all of this stuff, all these people who may have contracted any sort of virus. There's like, to me, there's no real reason as to why the either the NIH or the CDC or the public health commissions across these cities and states haven't sat down together and come up with a more sophisticated plan of how to track.
I mean, this requires resources and money, brother. A lot of money and resources. And therein lies one of the fundamental problems in this situation.
Mhm. But they can track criminals all over the place. How is it possible?
But that's profitable. You can use criminals to build up, to as cheap labor. There's a profit in that.
Mm-hmm.
But there is no profit in preventative measures.
Mm-hmm.
This is one of the fundamental problems. Again, you look at some of your state and local health departments,
Mm-hmm.
many of them are not as well funded as they should be.
That's right.
The NIH has had more than 3 billion cut from it in the last couple years. I mean, you're looking at the CDC done took a pretty heavy hit too to its funding.
Mm-hmm.
So I mean, again, this is the cornerstone of dealing with public health and certainly with infectious disease epidemics.
Mm-hmm. So wow, man. I mean, you need data scientists, you need information architects, big, geospatial engineers and things like that can track these type of things in mass. You're right. It is a very lengthy and expensive process. But if you want to stabilize your freaking country, I mean, you would think that they would do something like this. I mean, there's got to be. I know Facebook and Microsoft and Google, all these companies are just chomping at the bit, saying, "Hey, I got data. We can build out a system for you guys." There's got to be them doing that. Google Health, Facebook, big data, and Microsoft, and all these companies. They got to be looking at this and saying, "We have data that can help you track all of these people," because Amazon does it all the time. That's how they, determine, with Amazon Prime, how fast, they can ship an item to you, masks and gloves and stuff like that. But when it comes to infectious disease, there doesn't seem to be a whole lot of emphasis being put behind it. And then people wonder why, we can't seem to track, all these, these HIV carriers in the southern region for whatever reason.
Yeah, this is really the cornerstone of public health prevention. And again, we're dealing with something where we have something. There's a term used in public health, where we call it herd immunity.
Okay.
And basically, what that means is that if you had an infectious pathogen, for example, if you had one person gets infected,
Mm-hmm.
Potentially what happens is that if they go back to a particular environment, to a particular area, whatever, they have the potential of infecting everyone in that area.
Mm-hmm.
And likewise, if let's say they have an immunity to that pathogen, then they have the potential where they don't spread that pathogen to other people because they have some immunity.
Mm-hmm.
In that particular, if that makes sense.
Right. Right.
And so yeah, I mean, this is something that is very, this is what public health surveillance is about, is that you're being able to track diseases, you're being able to track where you're seeing endemic areas of the disease, but also where you're able to see really just how to sort of more or less track more or less where you're seeing maybe clusters of it per se.
Mm-hmm.
Where you got, maybe you have this group of people in this particular area. There's a huge cluster of people in this area that has this disease. It doesn't have to be the coronavirus, it can be anything.
Yeah.
And maybe these group of people over here don't have it. And the question is why? And this is stuff that, it takes years of training, years of education to get people to develop these skills where they can be able to do that. And the problem is that if you're living right now, we have a government right now that, quite frankly, doesn't really believe in science, but
There's a lot going on in the manosphere too. People don't believe in science. In space too.
Yeah, and so you're seeing and that's why and a reflection of that is the fact that you're seeing all these cuts and in these health programs and these science programs. I mean some of the cuts that Donald Trump has proposed over the past year will be hitting a lot of places like the NIH, the National Science Foundation, stuff like will be hitting these different institutions pretty hard.
Yeah.
And now we have this coronavirus that is just proliferated all across the world, and now you know why we need this.
What is the role of the WHO?
Well, the WHO, their primary job is really at least at least as it pertains to corona, their job is to track all of these cases developing across the world and being able to design really interventions behind how do we quarantine this. How do we stop this? How do we stop this virus from spreading from one area to the next? That's really where they're at. That's really what they're supposed to be doing. They're supposed to be tracking this. Now I know it's been somewhat a little spotty on their part.
So realistically, there is no cohesive measures by all these agencies within the United States. They're not. Are they talking to each other? Do you know if they're talking to each other?
Um, I would imagine. I would imagine that they are. They have to.
Yeah.
I mean, again, I think ideally they would be preparing for worst case scenario. So I would believe that they would be talking to each other. Um, again, I don't put it past them to not be doing it, but however, I do believe if they would be doing that. That makes sense. But yeah.
You would think it would make sense, right? Because some kind of medical liaisons, right? Scientist liaisons.
Yeah, I
Talking.
mean they have that. I mean, make no mistake about it. They have that. I do think that the fundamental problem is really an issue of really resources. Do we have the adequate number of resources? Do we have adequate personnel? Do we have adequate amounts of money to really put in place an adequate plan that will really address the quarantine and really the effective isolation of this issue of the coronavirus. But then again, it's just so hard to do it because I think right now we're at a point that there are just so many people infected, brother, that I don't think we can. There's no way possible we can really tell how many people have been infected. There just really isn't.
It's interesting. I saw a case the other day. Some Russian guy in Moscow faked it, and they really gave him that work too for faking it. That's not something you want to play games with. So we don't really know who's really, to me, in my opinion, you really don't know what the actual number is because there's so many people, coughing and saying, "Oh, well, he has it or she has it."
Yeah.
There's no real way to really determine this because no one has really.
Well, and this is why you need a good public health program that deals with surveillance and detection. And again, you need money. You need good skilled people to do this. And maybe some jobs. Maybe it's a career some brothers should consider. You know, it can be very good paying careers, but as a whole, that is the major problem because again, you can just pop up with a cold, a sniffle, a sneeze, or whatever, and the automatic thinking, oh, he got the coronavirus, and again, of course, people are gonna start panicking. A health system, they might bring you in and monitor you. Think about all the cases you heard where, well, this person has some symptoms, but we're not sure, but we're bringing them in for the next few days for monitoring. How much do you think that costs?
Oh yeah. Oh yeah.
I mean that is the problem.
I saw a recent, for whatever reason, the advertisements, that pop up on these browsers showed a master's in public health. I said, isn't that interesting?
You know, some of the big, public health is kind of this really broad thing, and encompasses a lot of stuff. Maternal child health, infectious disease,
Mhm.
um, chronic disease, genetics, genomics. I mean, it encompasses so many different things. So, if you say public health, you can go into everything: biostats, epidemiology, toxicology, environmental science, occupational health. It encompasses so many things, because I think a lot of things that we do every day are actually in the realm of public health, but most people never realize it.
Right. As,
The very fact that people are, this article you have the picture up of with the guy with this thermometer scanning the gentleman here. I mean, people sitting at the airport doing that, that's public health.
yeah, yeah. They even have not data science, cybersecurity in public health. I found that interesting. Boston Public Health Commission.
Actually, they actually have, if I remember, I know for sure the the NIH, there are divisions within the NIH that actually offer fellowships in public health cybersecurity.
Yeah, yeah.
So I mean, again, these are major, you know, these are areas, are certainly areas that you're going to need more highly skilled, highly educated people to perform these duties. But also too, um, this is just kind of where we're moving into. We're moving into I think we're moving into an era where, things that we think about, and it's not just this coronavirus, but just think about in general, bioterrorism in general. We're in an era, excuse me, where is, conventional warfare is really going to become a thing of the past.
Yeah.
It's really going to be more about digital warfare, bioterrorism. That's really where it's at. A conventional war is so messy. You got to think about troop movement. You got dead bodies. You got people. You got injured bodies. You got casualties. You have all these things.
Mm-hmm.
And as you see with something like the coronavirus, it's perfect.
Yeah, yeah. And you don't know where to put the finger.
Yeah.
Basically.
Don't know who did what. It's absolutely perfect. And just imagine if it was more lethal. With all the people that have been infected in China, if let's just say this disease had 20% mortality, that is a significant number.
Yeah.
You don't even need it to be 100%, have 100% mortality. If you had just 20% mortality, that is a significant number.
Even at 5%, that's still pretty significant.
Yeah,
where it is.
absolutely.
That can grind. That can grind their economy to a halt, even if it's just 5%.
Well, that's what we're already seeing right now in China.
Yeah.
It has put many of their markets to a standstill virtually. On top of the fact that if you think about that, just was it they canceled MWC, so the Mobile World Congress that takes place every year in Barcelona.
Yeah.
Yeah, they canceled that. That was supposed to take place like a week or so ago.
Yeah.
They canceled that. Yeah, I was just reading an article early today. I guess Apple had closed their manufacturing plants in China. You had, was it Hyundai, the auto industry. They've certainly felt the effects of this. So I mean, again, when you're thinking about really the lasting effects of something like the coronavirus, and why the coronavirus is not just deadly for the fact that it can kill people per se, even if it had 5% mortality, is also thinking about sort of these other effects, the financial, the economic effects that it has on a country. Think about it in a place like Africa, where it's already a land that has these countries that are not as well developed. They don't have a very well developed health system in these countries, and most of them, maybe minus South Africa.
Mm-hmm.
And even then, there's only so much they can handle.
Right.
You think about how something like that can devastate, countries in Africa, especially given China's economic ties with various countries in Africa.
They blocked several flights. So I saw that before we started the live stream. They blocked several flights to Africa from China. So Kenya, Ethiopia, those eastern East African countries, they actually block their flights from China. And actually, what I've also heard earlier is that they're actually getting rid of some of these, I guess, these Chinese nationals that are there, amongst other things that they like to do there. So, I bring up public health because I think this is a perfect opportunity for brothers to really start thinking about careers, man. Black people in general, but brothers in particular, stop thinking about these are opportunities where brothers can actually intervene in these areas. Especially
There's such a lack of talent in these areas.
Mhm.
I mean, it is. You know how they originally found out it was the coronavirus. How because to give people a little background on the coronavirus and just kind of even just really sort of highlight really sort of the how serious this version of the coronavirus is. This coronavirus has killed more people in about 2 months, in about 2.5 months, than SARS did in over a year.
Yeah.
SARS killed about 800 or so people. We've seen at least 1,000 deaths from the coronavirus
Mm-hmm.
in about 2.5 months.
Mm-hmm.
So just something to keep in mind. But also too understanding how did they figure out how were they able to pinpoint where the coronavirus came from? Because they did whole genome analysis of the coronavirus.
Say that one more time.
They did a genome analysis of the coronavirus. That's how they were able to find traces of some of the studies are saying bat DNA, snake DNA. So which means that it potentially went from maybe a bat to a snake and then jumped and did a cross species and then jumped species from a snake to a human. Because typically the coronavirus is found in animals, not humans.
And what's the impact on the animal? What happens to an
For
animal?
animals, they're just usually carriers. Nothing really happens to them. They don't get sick or nothing like that. They just carry the virus. And so for the problem is when it jumps from when it does a cross species jumps, when it jumps from an animal species to a human host, that's the problem. Because now you have a human host that has never been exposed to this virus, so they don't have the antibodies for it. So now it causes a reaction. Now it causes an immune response in the body, which leads to the problems we're seeing now.
That's interesting that they carry this this infection, but it doesn't do anything to them. A snake or a bat. They're not out there coughing or anything like that, right? They don't have all these symptoms where they dry eyes or anything like that. Like they're just flying around and slithering around, but they're not actually impacted by it. I find that very interesting.
Yeah.
So it went from a snake to a bat or a bat to a snake?
I'm not entirely sure, but it seems to have come in contact with at least a snake and a bat before it moved to humans. So I'm not entirely sure, and that's been somewhat debatable, I suppose.
That food chain doesn't seem to connect very well to me.
But the problem is where Wuhan and essentially where it came from in Wuhan seems to have been some type of animal district where they have a lot of different exotic animals, and so they had bats and all kinds of exotic animals there. And I don't know exactly what happens there at that market,
Mm-hmm.
but apparently they just had a number of different kinds of animals there, and that's where they pinpointed where the virus made the cross species jump.
Interesting. Because Africans have always lived around, I guess the animals of the continent, right? But you never heard of anything like that happening over there.
Yeah, without getting into the weeds here, because I usually don't delve into this.
Right.
I would say this much. I do think the origins of this virus in particular are somewhat suspicious.
Mm-hmm.
I will say that much. And without full disclosure here, I was having this conversation earlier with with a mentor who's he's a vascular surgeon, but yeah, and he was speaking about his thoughts on it. He was just saying he had some questions really about the pathogenesis of this disease, of this disease because again it everything about it just seems so perfect. It's in you're infectious whether you have an active, whether you're symptomatic or asymptomatic. You know, it spreads very easily. We know for sure there's at least one method and maybe potentially three other methods of transmission. I mean, there seems to be no method right now that which has not been explored that potentially you may be able to get the virus. I mean, again, it was just last month where they finally confirmed that, well, I think one of the cases out of Germany, if I remember correctly,
Okay.
that yeah, asymptomatic people are giving the virus to other people, even though from the very beginning there have been a number of folks out who said no, this asymptomatic people are infectious. So that's just something to keep in mind.
Yeah, see, it seems to when I've read, it seems to mutate. It's never the same once it transfers from one person to the next. And see, they said they have 19 different strands of it.
Yeah, there's quite a few strands. I think there is 19 different strands. Again, like I said, there's so many of them. It's really, unless you're a microbiologist or something, it's really hard to keep track with all.
Yeah,
it really is. Yeah, I know there's quite a few variations of it, but it really is difficult to keep track, and so yeah, that has been one of the major problems. Is that because again, it looks like any normal routine cold. You keep in mind the coronavirus has popped up during flu season.
right.
So people people that are getting the coronavirus and they can become symptomatic, it looks just like the flu. And you can't distinguish unless you just sit there and observe. You bring them into a hospital for observation, and then maybe they might go into acute respiratory distress syndrome, maybe. And then you'll know for sure what it is. But by that time, I mean, or at least the viral load would have built up enough where you'll be able to get a decent culture of it.
Now, if we think about the response to this, is that I think they dropped something like 3,000 plus PLA nurses.
Well, I mean, again, can you give me just a second? I got a phone call. Can you give me just a second?
Right ahead, go ahead. And so we have these conversations because I think it's important. I mean, obviously this is a world issue, right? Global issue. But I think that we should really look at this and how it can actually impact somebody within the community, because you got people shacking up with each other, cohabitation, no proper access to quality care for that matter. What happens then? And so people, especially Black men, they're less likely to go see a doctor. So they can have all these symptoms and nobody, he may shrug it off. He may not, he may try to self-cure himself and, drinking all types of Gatorades and foolish, sort of concoctions, to try to rid these symptoms. In reality, it could be really carrying this, not really know about it. So I do think that it's important to at least have the discussion for an hour or so, because people really don't know in the community. There's a lot of misinformation being spread throughout the manosphere about all of this, and it should not be spread. It's effed up that people are actually taking the time to spread FUD throughout the manosphere, throughout this social space, and try to make it seem as if that their information is greater than what we're actually seeing on the screen. There's no way for you to actually determine that unless you work in medicine, for that matter, or healthcare or public health. And so we have these these are areas I think that we should actually be invested in, you know, from a academic standpoint as well as a career standpoint. I don't work directly in healthcare, but I have worked in a big pharma, and I can tell you they're having these conversations. All the pharmaceutical companies are having conversations about what to do about this.
Yeah, I'm sorry, I'm back. Yeah, I heard part of that. You know, the thing about it is that everyone, the big talk for the last few weeks has been about developing a vaccine for the virus.
Mm-hmm.
And right now, allegedly there are clinical trials. I hear there may even be, there are trials going on, maybe potentially some clinical trials involving humans.
Mm-hmm.
So, could potentially have one to market in the next few months, maybe most likely probably near the end of the year. But again, right now I know the NIH is working on one. You obviously, I want to say, is it Gilead, one of the major biopharmaceutical companies, which is ironic because they're the ones that developed one of the newest Hep C treatments on the cures on the market now. They got one of the newest Hep C cures and treatments on the market now. And so, I mean, yeah, right now, I mean, this virus is proven to be profitable for certain sectors of the economy, for sure.
Yeah, absolutely.
I goes back to what we were saying earlier. I mean, you have the pharmaceutical company. Yeah, a lot of them, they are questioning what to do about this, because I think on some level it does have them stumped, but it also very much a money making opportunity.
Mm-hmm. Yeah. I mean, it's a profitable sector for a lot of for everybody in the supply chain and logistics. From people with sterile gloves and hand sanitizer treatments to masks and what do you call these things? The eye protection. Now you see people walking around with eye protection looking stupid and goofy. But I also question some of these medical assistants, who are walking around in public with these scrubs on, and then they go into the workplace after sitting on a dirty bus and a dirty train and dirty benches.
That is somewhat interesting. I mean, again, that's a very interesting observation. I guess my best guess on that would be that potentially could have come in contact, most likely, maybe yes or no. I mean, I think right now in the US, there has not been, I don't think a lot of people have really been exposed to it.
Right.
Which is why right now I don't think we really hit the peak of this pandemic yet, is because again, now it's just starting to hit, these newer parts of the Western world. And again, unlike China, where you have a high population density, which made it primed to spread, in the US, people are a little bit more spread out, but also too, the quarantine measures, and I think this is something for folks to keep in mind. If they didn't, it's been underreported in the media, exactly really the seriousness, the gravity of the situation as it relates to coronavirus. But I think a key thing to point out, the government went out of its way to establish military bases as quarantine sites.
U.S. military or Chinese military?
The U.S. military.
Oh, yeah.
There was a number of bases. I think one was like in Colorado. I know there's a few of them across the country that they've gone out of their way to establish these as quarantine zones for individuals infected with the coronavirus. And they would not have done that if they did not think this was serious. And I think, again, we're looking at sort of really these first line responses to dealing with an infectious agent. It's trying to quarantine and hoping that quarantine will be enough from keeping the non-infected population from becoming infected.
Well, Black people are already quarantined. They live in the projects.
That's actually interesting you bring that up, because there was actually a case study out of China. I want to say it was probably the early part of the last month. And they, what they did was there was a particular apartment complex in China. I want to say it might have been in Wuhan. Could be wrong. I can't remember. Um, and essentially what happened was that virtually everyone in that apartment complex, we're talking over hundreds of people, got exposed, were all tested positive for the coronavirus. And they could not understand because initially there was only one person in the that had tested positive for the coronavirus. Then all of a sudden everybody in the complex had the coronavirus, and they couldn't figure out exactly why. Because you have to explain. Well, this person lived the initial person lived on the bottom level, but we're talking like 8, 10 stories up, and they could not figure out. Well, how did they get there? And so some of the theories suggest that when people use the bathroom, and remember what I said earlier about them testing the stool, and for the one gentleman out of Seattle, if I remember correctly, where they found traces of the coronavirus in the stool, and what was being suggested by the Chinese scientists was that they're thinking that when people have bowel movements and they use the bathroom and you flush the toilet, your stools get aerosolized,
Really?
and those particles actually move through the air into the ventilation system, and eventually getting through the rest of the apartment complex.
Wow.
And that's what they theorized, which I think is very, very interesting.
So what would be the approach to something like that? Like, how do you counter something like that from it aerosolizing?
I mean, mask, maybe some type of filtration ventilation system. Um, uh, you know, that's a hard one, man.
Yeah, it is.
That's a very difficult one to deal with. If that's truly what happened there, then yeah, that's very difficult to deal with.
Unless they moved like a composting toilet or something like that.
Yeah, I mean, again, I can't remember what was that one show they used to, I don't know if they still show it. It used to be called, was it Mythbusters, I think?
Yeah.
Yeah, and I used to watch the show pretty religiously, but years ago they had this one episode where they showed how when you flush a toilet, and they had this slow motion camera, and they showed when you flush a toilet what happens. And literally, when you flush the toilet, you just saw all these particles, like they're so small you can barely see them, but they were able to capture them with the camera, and you can just see like this spray coming up out of the toilet.
Because the pressure is pushing it back
Yeah,
out.
yeah. And that, like I said, going back to what I was saying about this particular case study in China, that's what they're suggesting may have happened. That people might use the bathroom, and they're infected with the coronavirus, and when they flush the toilet, though those infected stools become aerosolized, and gets into the air, moves through the ventilation system, and potentially get into the respiratory tracts of people who breathe in the air.
Duly noted.
So yeah, I mean some very, very interesting. I think it's one of these things, brother, that right now, I mean, there are just so many unknowns going out. Because right now there's no official treatment for the coronavirus. All you can do is just support people while they're going through the symptoms or whatever. You can support them, but outside of that, for people who might develop acute respiratory distress syndrome, yeah,
Mhm.
they may be, you know, you know, there's a few other things you can do for them. Maybe they might need to be ventilated, intubated and ventilated. I mean, that might be the case for them, but also, but in general, but for the most part, there are no official treatment methods for the coronavirus. So the only thing you're doing is really doing supportive measures.
But the hospitals would have to, come up with something. I mean, they can't just turn people away and say, "I'm sorry, but take 2 of these and call me in the morning."
Yeah, not quite that simple, brother.
Hey,
Okay.
what's going on, you guys?
Hey, what's going on, dude?
Hey, real quick, Doc. I wanted to come in because Dr. Phoenix, you were saying something, man, and I shit you not, dude. I saw something years ago about what you were just talking about. Like when you go to the bathroom and you flush the toilet, and it's like this mist that's created, right? That comes
Yes.
out. And they were talking about people who leave their toothbrush like within the vicinity.
Yeah.
Yes, I saw Johnny Blaze's comment in the chat because he was just saying the same thing.
Dude, this was like a literal study, man. I remember seeing this shit like 15 years ago. And dude, I shit you not, dude, I like kept my toothbrush like as far away as from the fucking toilet as I possibly could.
Mine's,
After it was like a Nightline, or do you remember what was that? Was it called Nightline? It used to come on Friday nights on ABC.
Yeah, I think it might have been Nightline or 2020.
Nightline. Yeah, 2020. That's what it was. 2020.
yeah, and I keep my toothbrush in a container. So,
Yeah, I actually have.
Yeah, they were saying you got to put the thing on top of the bristle part.
nah, my whole thing is inside of it, man.
Or the whole thing. Yeah, you either cover the bristle part or put it inside a container. Yep.
Like a big ass condom for it, man. Strap it up, man.
Oh shit.
Yeah, you know, and what, you know, and yeah, you know, I keep my toothbrush covered as well.
Mhm.
But I would say this: ideally, you should be cleaning your toothbrush at least once a week, if not at least every 2 weeks.
You can dip it in mouthwash.
Well, you can use a minor solution of just really a little bit of bleach with some water. You can do that and just kind of soak it for like about 20-30 minutes or something, and let it air dry. But yeah, you can do that. You know, just a little smidgen of bleach. Nothing, you know, don't pour the whole damn thing. But yeah.
Now, complex.
Like literally like one drop.
yeah, maybe a capsule at most. That's it.
Now, complex. Do you know of any sort of cannabis strain that can actually alleviate some of the symptoms of the coronavirus?
Of the coronavirus. Now, this would be like flu symptoms, right?
Yeah.
Dude, okay. So, yes, because there, you know, Mike, I think maybe, gosh, this may be like 6 months ago, we did a cannabis hangout and then we covered an article about how hemp and cannabis how the potential for it to be used as a flu vaccine. Okay, right. We actually covered this maybe like about 7 months ago, man.
Mm-hmm.
So yes, and so here's what I wanted to say about that. One of the things that my wife and I were working on, we were talking about making a line of tinctures. Okay.
Okay.
Right. So what you're doing is you're making the extracts, the pure extracts, and then you're doing like a ratio, you know, so you're gonna do like you'd make like an echinacea extract, you'd make an cannabis indica extract, a hemp extract, and then maybe like a chamomile extract, and then maybe like a few others. And so then you're gonna do maybe like a 1:1 to 1:2 ratio, right? So 2 parts cannabis, 1 part all the other ones, and then into a tincture, right? Which you would then take sublingual. Now I had already tried just pure cannabis tinctures, and like it's some knockout stuff. You know what I mean? So I do want to say that if you're going to take more of a holistic, more nutraceutical approach, you know, it's no different than taking like echinacea or Dr. Phoenix, what's some of the other ones that they take for like cold and flu? Like the herbal nutraceutical. What do they take? Elderberry. Elderberry, I think is one.
Elderberry, yeah.
You know.
I
mean,
yeah, go ahead. Oregano really, tends to be a really powerful one.
Mm-hmm. So that's kind of where I see the cannabis and hemp applications. It's more in that venue, more of going nutraceutical with it.
Yeah, I you know, it's interesting because I think part of, fundamentally speaking, going back to the whole flushing your toilet. And the case study I was talking about is that understanding that, is very interesting because again, you're seeing people getting infected with the virus and they don't even know how they got infected. And that's kind of scary when you consider it. If you don't know how people are getting infected, but yet you're having scores of people showing up and they're infected with the coronavirus, I mean, I think that's a major problem.
Right.
You know,
Because they got some they actually we have two recorded, well, no, what more than that. We're talking maybe a couple hours up the road in a city called Tulare.
mhm.
They just yeah, somebody up there has got the shit.
Yeah, I think right now I think they said there's roughly about 50 or so confirmed cases in the U.S., something like that right now.
Yeah.
Um,
Yeah.
I think in all honesty, I think a lot of people have contracted the coronavirus, and and really they just kind of had some really mild symptoms and kind of got over it and kind of went on their way. I
Yeah, I
think
was gonna say, do you think it's kind of like, oh, okay, well, at the time that we tested, we we caught it, right? We got somebody with it. Not to say though that somebody may have contracted it and just through their natural own immune system.
yeah. Again,
Right.
this virus tends to be deadliest for people 50 and older, and and those who may have some form of who may be immunocompromised by some for some mean or some other chronic issue. And so specifically, if you were if I were a betting man, what I would say is that this virus is going to be in rotation like you would see a seasonal cold or flu rotation.
Damn, really?
Based on the way it's headed,
Mm-hmm.
that would be my guess. That'd be my hypothesis. My hypothesis. I could be wrong, but that'd be my hypothesis.
No,
I
it's
would think so.
interesting.
I
A
would think,
seasonal corona
yeah,
type of deal.
yeah.
Right.
So if that's true, you heard it here first. So
What did you think about the when Mike asking about sort of like a hemp or cannabis, like that whole angle? I was what did you
yeah,
think about
I
that?
think
And then what are also maybe like your thoughts on like maybe other ways of applying it?
I mean right now because there are no true treatment options for the coronavirus. I
Mm-hmm.
mean right now, as far as I'm concerned, everything's on the table.
Everything's on the table, right? Okay.
You know, whatever works well. Again, for people that may be immunocompromised or they might have some chronic condition like diabetes or something like that. I was specifically honing on diabetic folks because they already have a compromised healing process by virtue
Already, right?
by having diabetes. And you think about that. You know, maybe some non-traditional medicinal means may work better for them.
Right.
Maybe a tincture made with oregano or echinacea or elderberry or something like that may be effective. you know
Yeah, and that's kind of the
I'm not
angle we were
entirely opposed to
taking.
that.
Yeah, that's kind of the angle we were taking. It was similar to kind of how they used to formulate NyQuil way back in the day when they before they changed it to an alcohol base. They used to use an indica base.
Yeah, yeah,
You
yeah,
know,
yeah.
go look at the original formula of NyQuil, man. What used to knock you out was some Kush, basically.
Yeah,
Hey, Johnny Blaze got his hand up, man. Go ahead.
Yeah,
yeah.
go ahead, dude. Go ahead, dude.
Yeah,
Hey,
you
what's going on,
good,
fellas?
bro. Hey, what's going on?
Hey, not too much. Hey, just want to ask two questions, Dr. Phoenix.
What's up, man?
Number one, the testing for the coronavirus, how effective would you say it is right now?
We were, Jay Blaze, we were talking about that earlier. And it's funny because Mike had an article where it showed the gentleman with the thermometer measuring the guy's temperature.
Yeah, I saw that.
Yeah, right now I think it's not effective. It doesn't work.
Okay.
It doesn't
All
work because the problem is that there's an incubation period.
Mm-hmm.
And in that period, the virus is building up, the viral load is building, And so people are not symptomatic. So people are just look 100% healthy.
Right.
So whether, and even then, even if you were to test, let's say you tested somebody in that asymptomatic phase, there's a good likelihood that the viral count isn't high enough to be detected.
Right.
So the test itself is not well, I guess I'm trying to figure out, is the test ineffective, or is it just we don't have a test right now that is designed to match its incubation period?
There's no.
Yeah, I think it's one that specifically matches this version of coronavirus. Absolutely.
Okay.
And really the test will only be probably more effective when people become symptomatic.
Okay.
And then you'll be able to say, okay, well, what's going on here? And so yeah, you be you be able to see it then. However, I just think right now, because this virus is really, has had this active period now for since what, early, around the second week of December, and
Right.
we're now just going into March, so roughly about 2.5 months or so. Right now, I just think we're in the early, it pretty much hit everyone by surprise.
Okay. Yeah.
And
All
so
right.
I don't think, now that everyone's been scrambling now for the last couple months to trying to find an effective way to test for it. Again, by the time people really, or at least for folks who have more adverse reactions from the virus, or complications, excuse me, by that time, for many of them, it may be too late.
Right.
They may have developed ARDS and it kills them.
Yeah, I was watching a video on this guy. He broke down how it actually affects the lungs, more so the alveoli of the lungs.
Yeah, that's where the gas exchange occurs.
Yep.
In the lung.
Pretty much, it's breaking down the whole gas exchange process. But I was going to ask you, you ever heard of something called, and I'm probably going to pronounce this wrong, colloidal silver?
Oh, colloidal silver.
Yes.
Yes, I'm familiar
Yeah,
with.
colloidal silver.
Okay.
I know folks use this as an antibacterial, antiviral. And again, it came out of the olden days. If anyone's familiar with, in the years prior to modern health, or or medical technology, or science per se, we'll go back to the 1800s, for example. What they would do with that, they actually would put silver ointments into the eyes of babies when they were born.
Okay.
Yeah.
To prevent eye infections. And that's essentially
Dr. Phoenix, didn't they do that up until as recently as like the 80s?
Yeah, they were still they
that was insane. They were still doing that shit
used in many respects, and silver is still used in medicine. Make no mistake about it. It still is used.
Okay. Right.
Specifically because of its antibacterial properties.
Mm-hmm.
Okay.
And so, however, I will say this much: when I was an undergrad, I had a clinical rotation at one, and I was in a neuro ICU, and this particular individual slammed their car into a tree at 120, but they had also been taking colloidal. Oh my God, I can't pronounce it today. Colloidal silver. Yeah. And the problem is that people who take a lot of colloidal silver, it turns their skin bluish gray.
Yes, I'm familiar with that.
Wait. Wasn't there a guy who literally turned blue?
Yeah, and what I was saying about this particular client that I had, she had been taking a lot of the colloidal silver, and her face from the neck up, everything from the neck up was bluish gray.
Wow.
She almost looked like a little popper. She almost looked like one of the Smurfs. And
right.
So I mean, it's one of these things where I'm not opposed to more holistic means of health. Again, we know there are things that work. However, I think people need to be very cautious about what they use. I mean, there's a lot of stuff out here. People say, it cures everything from cold to cancer to AIDS and everything in between. And just do your homework. Be mindful of whatever it is that you're using.
Yeah, I was gonna say, man, because my mother-in-law, she deals in a lot of this stuff. Well, my wife's mother, she like if in her crib, man, if you look in her cabinets, Joe, it's literally like she has her own apothecary like in her house. It's literally every type of herb, every type of extract, every type of anything you could think of, colloidal silver included, you know. So there is and Dr. Phoenix, maybe you could, is it a is it a naturopath? There's a branch of medicine
Yeah,
where
naturopathy. Yeah, so
naturopath. So
you have naturopaths, but you also
yeah.
have something in more traditional allopathic and osteopathic medicine. You have a particular specialty called integrative medicine.
Integrate. Okay, so this is what we were trying to pursue for my wife, because she had the she had the adverse side effects. She fell within the 10th percentile for the chemotherapy that she was using. So we were looking to incorporate integrative medicine.
Yeah.
That's where my partner in Chicago, Evan, comes into play with his company that does dude, I always butcher this word. Pharmacogenomics.
Yeah, pharmacogenomics. Yeah.
Yes. And so that was the angle that he was taking with his cannabis-based firm.
Yeah.
Was to use that as a, you know, as an angle into integrative medicine.
Yeah, you know, and that and I think that right now, you know, is not one of the most well known or popular fellowships, because typically to do integrative medicine typically is usually for family practice docs that can do that. I maybe it might be open to other specialties, but I know for sure I've met a couple and they were all family practice docs by training before they went into integrative medicine. So
Oh, okay.
but yeah, but that particular branch of medicine does focus more on holistic, more Eastern traditional medicine, not just the Westernized approach per se. So you're dealing a lot, you know, you learn everything about herbal therapy, aromatherapy, stuff like that. Because I mean, again, there's a lot of studies that even show that, you know, even in operating rooms using lavender, how that helps to relax people, create a more therapeutic environment. So I mean, there's a lot of studies that show the efficacy of, you know, various herbs and oils, essential oils and stuff like that. So yeah, you know, that's, you know, something I, you know, again, I don't rule out people practicing it. I would just my only suggestion would just be, you know what you're dealing with, you know, because you
Well,
got
would you say that? Would you say that integrative
XYZ.
medicine?
Was
I
that
was going to say. I'm sorry. Go ahead, finish, bro.
I
I'm
was just
sorry.
gonna say, you know, a lot of folks out here say XYZ. You know, people really need to do their homework if you're gonna seek out these alternative means.
Well, I was going to say, and would you say that integrative medicine has legitimacy?
Oh yeah, it has legitimacy. The problem is that it's not really profitable.
Well, yeah.
You know, again, you know,
Don't even get me just started on that
integrative
one, man.
medicine is one of those primary care type deals. You know, again, that's why generally you see family practice physicians who get involved with it.
Right, but you know, if you're dealing with something like cancer and you want to try to talk to your oncologist about it, forget about it.
Yeah, you know, it's ironic you say that, because I know folks who have some rare forms of cancer like multiple myeloma, and you know, just trying to get your oncologist to, you know, maybe add some vitamin C, you know, give you a vitamin C infusion. I mean, that's, you have a better chance of getting struck by lightning.
Shit.
So
Yeah, man. Yeah.
so I do know that, you know, at least my perspective is that, you know, it is a problem. You know, I think, you know, for patients, especially patients, you know, cancer patients and such, you know, you have a right to pursue the healthcare measures that best works for
Thank
you.
you,
Again,
brother.
we
Thank you,
know.
man. I swear, man, I battled so much with those doctors, man, over that type of shit. And, you know, I'm like, how can you tell me what How can you tell her what makes her feel better when she's telling me what makes her feel better? You know what I'm saying? It is just one of the weirdest things to ever have to deal with. Yeah.
Yeah,
Hey,
my take on it, brother, is just simply that, even as it pertains to the coronavirus, yeah, I know folks, I know black folks are really quick to go and try to seek these alternative means, but black folks really need to do their research on the coronavirus. You really do.
Yeah. Yeah.
You really need to understand what's happening when people get infected with the coronavirus. You really need to understand what's actually killing them, because what's killing them is not the coronavirus. And so that's something that
Yes.
folks need to understand. Because again, you're dealing, as Johnny Blaze was saying earlier with the video he was watching. Because I'm very familiar with the guy that does those videos that Johnny Blaze was watching. Because he puts up a lot of those for like med students and stuff like that. and so, one of the, the major problem is that arts and specifically coronavirus, because it does eventually it attacks the alveoli, is that it essentially it interferes with that gas exchange process. So in that gas, as a result of that gas exchange process, people become what we call acidotic, meaning that their blood pH goes down. So a normal pH value for your blood should be 7.35 to 7.45. So your blood has a very your body maintains a very, very delicate balance of neutrality, of acid-base balance and neutrality, and it doesn't take a whole lot to throw that out of whack. And so again, when you're dealing with folks, if you're going to pursue these alternative means of dealing with the coronavirus or whatever, you need to understand exactly what the process involves with someone who has coronavirus. Again, not everyone will get acute respiratory distress syndrome, but you still need to know. You still need to know this just in case.
hey, have any of you guys been to Lowe's or Home Depot lately?
What about it?
I was literally about to go there today.
All the masks are gone, man.
Yeah, we were talking about that earlier.
Well, no, I was gonna go there not for masks, but I was gonna go there. But yeah, I was hearing about that, man. Not only that, but if you go on Amazon, I was hearing some stuff. It was a CNBC clip that was in my feed about how eBay and Amazon, they're like, reprimanding sellers for gouging people.
Oh, yeah.
Like masks
They're
and
going
stuff.
Oh, they're gouging.
About that earlier.
Yeah.
Because someone, a friend sent me a link to the N95 mask on Amazon. And it's like $300.
Yes. Mm-hmm.
$300.
Yes.
The prices are going. They're on eBay. They're going up.
Yeah, there's somebody in the chat. I think I forget who just posted it, but they said they bought 20 of them back in December. 20 N95 masks back in December for $40. Now they're selling them, for a good
Wow.
Yeah.
I was in Lowe's yesterday. I went to Lowe's and Home Depot. And they had nothing. As a matter of fact, the guy was telling me I think every Home Depot is out.
Yeah.
Yeah, people are going into Home Depot, scooping them up, and then flipping them on eBay. This was that was in the CNBC clip that I saw earlier, and I was like, "What the fuck is going on?"
Yeah, guys running around with a ski mask on, like, yo, I'm good.
Dude, they're at my job. There's people walking around. I'm like, yo, what's really good around here, yo?
Here's the funny thing, because we were talking about this earlier, Complex, Mike and I, and I was saying, like, yeah, you got really this mass hysteria that's now hitting the U.S. Because now the coronavirus has done all it's gonna do, and well, it's still continuing to do its damage in China, but now it's hitting these newer areas, these newer lands, the U.S. and in the Western world, and so now, it was just like for the longest period of time, you maybe heard about 5 or maybe 10 cases in the U.S. and now you got about 50 or so cases, and I wouldn't be the least bit surprised if you have a couple hundred by the end of the week.
Well, no, dude, I'm telling you, they just found like somebody had it a couple hours up the road. Next thing you know, there's people at the job with masks, and I'm like, wait, what?
Yeah, I think I think this, if people are just wearing these regular little flimsy surgical masks, like I was saying to Mike earlier, don't even bother wearing it. You might as
Oh
well
yeah.
don't wear nothing at all.
Oh yeah.
Yeah. Because the N95 masks, those have to be fitted.
Yeah, those have to be fitted. Yes.
Yeah.
So I mean, those masks actually protect the airway.
Yeah.
Those regular little surgical masks you might see people rolling around with. You might as well take it off because it's not really protecting you from anything.
Yeah.
So I mean, but what I think is happening is that again, people are using this hysteria around the coronavirus to really make a lot of money.
Yeah.
Again, we're talking about N95 masks that on in any other, if this was a completely normal, no coronavirus, nothing, you probably find for about 40-50 bucks.
Yeah.
Now you're seeing it going for like 6 times the price.
Yeah, I think it should be illegal for people to go down to Home Depot and buy them in large quantities and then try to flip them in because you're creating a black market out of all this shit.
Yeah, no, I absolutely agree, brother. Absolutely.
Because I figure if the masks are going now, what's going to be next is probably going to be somebody's going to probably buy up all of the basic uh, immune immune response immune support medicines. Those will be next.
Oh yeah, there's been a lot of the rationing of you know I guess false solutions on Craigslist and these other places. I know eBay has cracked down on that already. We got an email from high up that basically said to be on the lookout for this type of stuff because we work in big pharma. So
Yeah, that kind of goes to what I was saying earlier about the if you're gonna pursue these holistic means, know what you're buying. Do your homework. But go ahead, Mike. I know you had the stuff up from the Boston um, Public Health Department.
oh no, I was just reading the blog because I was just looking for any updates that they may have been posted. Updated on February 29th. Information is rapidly changing. The Boston Public Health Commission will update this post as new and relevant information becomes available. So they've had. I actually live right down the street from them. They've had their little meetings and stuff like that. If they know something, they're not telling us. So, but interestingly enough, right across the street from the Public Health Commission Exchange is what they call methadone mile, where you see
Methadone mile.
hundreds of white people, man, just walking around like zombies, look like World War Z from all the opioid stuff, man. And they're very much at risk of all types of transferring of diseases and whatnot. And you see in broad daylight just sharing needles, man, on the street, like just nothing. I'm just gonna shoot up while I wait for this bus, to come. So
Yeah, never mind me.
yeah, man, I was coming home from work one day, man, and this chick squatted down between two cars, man. Just peed.
That's crazy, man.
Say that again, Dr. Phoenix.
I said that's crazy because believe it or not, I was actually seeing stuff like that a couple years ago when I was in Atlanta.
Wow. So it was black people.
Yeah, it was black folks, but obviously not the opioid problem, but just the homelessness issue. I mean, the homelessness issue in Atlanta was serious, man. Never seen anything quite like it. I think probably because it's warm and and so yeah, it was certainly very eye opening. But irrespective of that, I think what is key here for folks to understand about the coronavirus is understanding that one of the best things you can do is practice proper hand washing technique. Again, like I said earlier, at minimum 20 seconds under warm running water, washing your hands vigorously. Wash between your fingers, wash your fingernails, especially brothers, because men tend to not scrub their fingernails. So, wash your fingernails. You should be washing up to about your forearm level, and do that. Do that for at least a minimum of 20 seconds.
Yeah, hide your wife, hide your kids.
Yeah.
Damn.
So these are pictures from Methadone Mile, man.
Oh wow. Oh wow, they're like some Skid Row type stuff, man.
That is their version of Skid Row.
Wow.
Yeah, that's their version of Skid Row, man.
Holy, whoa. Wow, that is crazy. I never knew there was something like that in Boston. Wow.
Yeah, well, this would be the shelter over here, and then you have Greater Boston Food Bank, and then beyond this picture, let me see if I can pull up another picture. Um,
That is insane, man.
yeah,
Holy.
this would be what do you call it? Um, Boston Medical.
Hmm.
Yeah, this is Boston Medical, and then you have the Public Health Commission. You can't see it in this picture; it's across the street.
You know, one thing I do want to highlight, because this discussion is around the coronavirus and such like that. This is why it's so important, in previous discussions that we've had, and why I talk about the things I talk about. It is so important, for brothers to strongly consider careers, not necessarily just in healthcare, but sort of a lot of these other fields like public health. I mean, I've had the pleasure of going to the NIH a couple of times, you know, and you wouldn't believe, man, the level of talent that they have there. That's typically only the best of the best go there.
Mhm.
And when I and the times I went there, man, I mean, you don't see brothers there, not really. I've seen a handful of them, but you really don't see them. And I think this is a prime opportunity for brothers, to really strongly consider, careers in virology, microbiology, immunology, you know, healthcare, because even for folks that are on the front lines, like physicians and nurses, and you're treating people like, I mean, these are, and given that you did have really the doctor that sounded the alarm on the coronavirus in China, he passed away like a week or so ago.
Mhm.
You think about, he was actually a fairly young person too. He was pretty young actually, and you think about where these opportunities at, and just discussing the impact on the community. Again, you need brothers in these industries, in these fields out here doing this work.
Mhm.
You know, you can expect that these folks are, you can expect, quote, the folks to, people to come to us and have our best intentions in mind. That just, that it will never be the case. And so it's very important for black men to really strongly consider careers in like public health and epidemiology. I mean, I know a couple of epidemiologists. Like I said, one of the brothers that wrote one of my letters of recommendation is an epidemiologist.
Mhm.
And he's an older Gen Xer, but he used to do some work in Atlanta and Chicago back in the 90s. And so it's very important to understand that these situations, the pandemic of coronavirus we have now, these situations highlight really the need to have more experience, to have black folks and black men specifically out here who have this knowledge base. It can't just be a handful of us. This takes very much a concerted effort from all people, because as we're seeing, you know, the hysteria is being driven mad because, again, part of the problem here in the U.S. is that you know you've seen a lot of the funding get cut from some of these, or from the organizations that would be at the ground level fighting off fighting off diseases like coronavirus. Like I was saying earlier, you had the NIH that took a $3 billion hit in their funding. The CDC took a massive hit. So again, you know, you really have to, brothers really need to strongly consider careers in healthcare and in public health, and just in the scientific fields in general. You have to have these scientists out here who are doing this work.
Good points, man. Good points. I think that a combination of that with computer science or some kind of information systems.
It's funny because for brothers, I know a lot of brothers in the space are in tech. They got computer science, IT background. They're the NIH. They offer a number of fellowships in like public health, information systems. They offer in public health cybersecurity, public health informatics. bioinformatics, cybersecurity. I
Mhm.
mean, they offer a number of different fellowships for masters and above folks who are interested. So if you just get out there, just kind of do your own little research, you'll see. There's certainly the opportunity, and certainly the people with those computer science backgrounds, are certainly very much needed. But go ahead, brother. Yeah, put up something. Was that public health program you put up, look like? I didn't quite see that. Anyone there?
Yeah,
Yeah,
I'm still here.
Yeah, I'm here. I'm here. I had
oh,
to mute that
Oh,
because
okay.
call. I have Google Fi, so what happens here is
Okay, gotcha.
it will ring Hangouts too if somebody calls me. No, I just wanted to bring that up because I think you're making a very good point. I didn't know that about the NIH, but I only brought this up because it's right next to me and I saw it advertised as well, coincidentally. So
Yeah, if you go to the, let's see, I think it's the NIH is on. I think it's called the Institute of Allergy and Immunization. I think immunology. Excuse me, National Institute of Allergy and Immunology. I think that's what it is. Because this is these. Is this it? Let's see. Oh yes, allergy and infectious disease. Excuse me.
Hey, Doc Phoenix.
What's up, brother?
Hey, man, have you seen or have they shown any images of what someone's chest would look like um, from the corona, at least from the coronavirus? I'm assuming it would look something like pneumonia.
Yeah, actually looks very similar to pneumonia. So you'll probably see bilateral infiltrates.
Hmm.
So looks very similar to pneumonia. The only difference being is that where pneumonia tends to be, sort of really refined mostly to the lower lobes,
Yeah.
the coronavirus it does affect the lower lobe, but it infects the entire lung,
Okay.
and
I
that's
want to.
and that's the major reason why it kills.
Okay, because we're looking to do some major revisions to our pathology class for imaging.
Hmm.
I'm hoping to get some images for this that we can incorporate in that class.
Yeah, yeah, it would look very similar to a uh, if you were to do one of someone who had pneumonia. So,
Okay.
but I think I think the coronavirus is proving to be a very teachable moment, for especially for brothers,
Yeah.
because we have these conversations and we telling brothers, there are these opportunities out here and stuff
Yeah.
like that, and there really is. I mean,
Yeah.
again, no one has a real response to this virus.
No. And I'm glad you mentioned public health, and that's a career field. I totally forgot about that one, man, because public health in the military is typically very important. Them guys are like always like first one boots on the ground.
Yeah, I got a good friend. She's a physical therapist now. She's actually out in Complex's neck of the woods. She's Filipino, but she was preventive medicine, and when I was in the military, that's public health in the military, preventive medicine,
Yeah.
and so she was in that, and they did a lot of that stuff, that making sure that you had clean water sources,
Yep.
all
Hmm.
of that. So I mean, these are, like I said, these are areas that are vitally important, especially given that what Mike has been talking about since he went to Rwanda, and
Yeah.
since he's been back and talking about just sort of the initiatives and all the opportunities over there. Public health is very important over in Africa.
Yes.
I can't even stress. I can't even begin to stress just how important it is in a on the continent.
Because
So
another field that goes hand in hand with that is the bioenvironmental, because
exactly,
those two career fields between public health and bioenvironmental, they work hand in hand.
absolutely. You
You know.
know, the funny if the funny thing is that a lot of folks think of public health like, oh yeah, where we just we're dealing with maternal infant health, maternal
Right.
fetal health and stuff like that. No,
Food inspections, stuff like
yeah,
that.
yeah, yeah. Exactly, doing all your restaurant inspections, and dealing with lead, dealing with lead in homes and all that. No, no, no. It goes far beyond that. So, but again, but Mike brought it up, so I'll let Mike get to what he has up there on the screen.
I didn't know if you want to help navigate through the site.
Yeah. So let's well, it's been a while since I've been here, so let's go to diseases and condition. Let's see what they got. So they got anything on the coronavirus? Oh, yes, they do. So let's see what they got on the coronavirus. So anybody's not familiar, this is the National Institute of Allergy and Infectious Diseases. This is one of the schools of health at the NIH. And so again, this is a major research organization, biomedical research organization. And again, this is where you find some of your top scientists and clinicians here. And obviously, as you can see in the upper corners where it has all these tabs, you can see like clinical trials and all that. But let's see what they got on the coronavirus. Yep. Now their definition is that coronavirus are a large family of viruses that usually cause mild to moderate upper respiratory tract illnesses like the common cold in people. However, 3 times in the 21st century, coronavirus outbreaks have emerged from animal reservoirs to cause severe disease and global transmission concerns. And the part of the problem is that anyone's not familiar with the actual structure of the coronavirus. The reason it's called the coronavirus is because if you were to look at it, under a microscope, the virus itself looks like a crown. So corona means crown in Spanish, and so that's how it got its name. But
It also means beer.
but also, but also too, is also a very specific family of viruses. So it's called RNA viruses, meaning that their genetic material is RNA based. So it's not DNA based. You do have DNA viruses, but RNA viruses tend to be unstable by nature of the fact that it's made that their genetic material is RNA, and RNA in of itself is very unstable because unlike DNA, which has that backbone and that double helix structure, RNA is single stranded with no double helix structure, which in turn makes it very susceptible to degradation, but also mutation. And that's kind of goes to where it says where essentially what I believe happened is that you had these animals that served as reservoirs for the coronavirus. It mutated and jumped into humans. And so that's kind of where we're seeing sort of really this very infectious nature of the disease as a result. But because of that, understand that like there's a number of viruses that falls into these what are called RNA viruses. So you got like chicken pox, the flu, pneumonia, common cold. Those are all RNA viruses as well. That's why every year you have to get a flu vaccine because there's a different strand of the flu every year because it mutates. And that's by nature of it being an RNA virus. And because it tends to be somewhat unstable. So let's see what else they got here.
Go back.
Oh yeah, so if you go down to this, the third paragraph says, thanks to research and investments into SARS and MERS outbreak, which were also caused by other variants of the coronavirus, NIH scientists and grantees are better prepared to develop diagnostic and therapeutic vaccines against the COVID-19. That's what they're calling this
COVID.
coronavirus. Included in those projects are basic research to understand how the virus infects cells and causes disease, adopting platforms used to develop and diagnostic tests and vaccines, and evaluating treatments such as broad spectrum antivirals and potentially monoclonal antibodies. In fact, within 2 weeks of the discovery of COVID-19, NIH researchers had determined how the virus enters the cell. One thing to keep in mind about viruses, how they what they do, they're considered biological hijackers. And what they do is that they infect the cell. And so what happens is that they get into the cell, they hijack the cell's machinery. So think about like the various organelles within the cell, the lysosomes, the mitochondria, specific the nucleus, the Golgi apparatus, stuff like that. And what happens is that the virus gets into the cell, injects its RNA material into the cell, gets that cell to make a bunch of copies of that virus within that cell. Then eventually what happens is that it builds up so many copies of that virus within the cell bursts, and out comes all these new copies of the virus where they get to spread to other nearby cells, infect those cells, and do the same thing all over again.
Mm-hmm.
That's essentially how viruses work.
Or if you've ever gotten a computer virus, kind of the same thing. Yeah.
No. They do operate. They do operate very much in the same.
Yeah. Yeah.
In the same fashion.
I mean, my whole point in saying that and illustrating that is that, like, the lexicon, right, is that for a very reason. It's the nature of what a virus does.
Yeah. So one thing I did. What was that? Oh yeah. Another thing else I wanted to highlight, what they call monoclonal antibodies. So monoclonal antibodies, if anyone's familiar, ever heard that, what they are really they're immune cells, but they're all identical to each other, but they're all clones of that parent cell. So essentially, what it is that they're unique to that specific parent cell, but they're all just copies and clones of that cell, and they're all immune cells. That's what monoclonal antibodies are. They came mono meaning it comes from one parent cell that is unique. So just to explain that. Yeah, I think the rest of the stuff is not really really worth talking about, because the rest of the stuff I've already covered. Let's see what else they got here. Now they should offer, let's see, funding opportunity, blah 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 blah. Let's see what else they got for training. I know they usually have some type. They gotta have something on the training. Oh, hold on. Actually, you know what? If you go over to news and events, Mike, they actually got a clinical trial for remdesivir to treat COVID-19. So they just started this. Looks like this just started a few days ago. So can you see it under news and events?
Interesting. Very interesting.
Yeah. So let's see. Are you there, Mike?
I'm gonna step away for a sec.
Okay. Well, anyhow, I'll wait till you come back. Yeah.
There he is.
Okay. Yeah. No problem, brother. I was gonna say, if you go to news and events, if you look, there's if you go into the latest news and events, and then you go to one right under, if you click on the second one where it say NIH clinical trial of remdesivir to treat COVID-19, it's the second one down. Yeah, right there. So now this is in Nebraska, because if anybody doesn't know, currently Nebraska actually has a pretty decent number of cases of individuals infected with the with COVID-19. So let's see what they got. A randomized controlled clinical trial to evaluate the safety and efficacy of the investigational antiviral remdesivir in hospitalized adults diagnosed with coronavirus 2019 has begun at the University of Nebraska Medical Center in Omaha. The trial regulatory sponsor is the National Institute of Allergy and Infectious Diseases, part of the National Institutes of Health, blah, 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 blah. But yeah. Okay. So says the first trial participant is an American who was repatriated after being quarantined on the Diamond Princess cruise ship that was docked in Yokohama, Japan, and volunteered to participate in the study. The study can be adapted to evaluate additional investigative treatments and to enroll participants at other sites in the U.S. and worldwide. So again, if anyone's familiar with what was happening off the coast of Japan, was that cruise ship that apparently there was about 600 or so people on there, and sounds like there were at least about almost a couple hundred, at least about 100 or so people that were infected with the coronavirus on the ship. So, I
Quarantine the
think
ship though.
was that.
They quarantine the ship.
Yeah, they did, which is I think that was a bad idea, and I tell you why. It's it's a cruise ship. Anyone that's ever been on a cruise will tell you cruise ships, if you don't have a port side or a starboard side balcony window, I feel bad for you because the air is kind of crappy on cruise ships.
Wow.
Because again, you got so many people in an enclosed space breathing the same air. The ventilation is only so good on a cruise ship. And so it's a prime incubator for something like the coronavirus.
Right.
Yeah, and then you got all the poop mist.
Exactly. People are using the bathroom. I mean, it's a perfect environment to incubate something like the
I
coronavirus.
I this for that very reason I never understood the appeal of a cruise, but hey, to each their own.
Because there's a stupid TV show, The Love Boat. Stupid show.
Is that what did it?
Yeah.
Tattoo, the little Hawaiian guy.
No, that's Fantasy Island.
Oh shit! I'm getting my '80s TV shows mixed.
I don't trust you for the hip hop trivia, man.
Hey, this article that you're reading, the guy who's in that trial, they had him on Fox News. I saw a YouTube video on him this morning.
Really
Yeah, they were interviewing the guy.
interesting. What was his take? What was he saying?
So the guy, he was there. As a matter of fact, his wife is still in Japan. They got separated somehow, but he has to go through so many positive and negative tests. In order for him to be released, he has to have 2 consecutive negative tests of the virus. But right now, apparently he was non-symptomatic though. He said he was feeling fine, but he did test positive for it.
Okay. Okay.
But that's what I remember from watching the short clip.
No, and that's interesting because I think actually I think there was a couple of casualties from the virus in Japan, and I think they were two of them. I think they were the ones on that ship, if I remember correctly.
I know there's one case in Vietnam now, 2 cases in Thailand.
I know you guys have mentioned this country before, but I think they need a lot of kudos for how they've handled it because they handled it in a true technocratic fashion. Singapore.
Yeah.
Singapore is technocratic.
Yep.
Yeah. No. That was my point. Was that the way they handled the virus was very much how I would have done it. And that's why you're not seeing no problem, even though they're in that same area as Taiwan and Thailand and all of that. They're not dealing with that. For them, obviously it's a concern and obviously for obvious reasons, but again, they're not having those issues that you see some of these other Southeast Asian countries are having. And I think very much is how they've approached to dealing with the issue as around the coronavirus. So I think that folks should go read up on that how what they've been doing. Mm-hmm. But yeah, I'll say that much because I think part of what's happening because Redemsivir, because if you go down in the article here, it says let's see, hold on. There are no specific therapeutics approved by the Food and Drug Administration, FDA. Again, FDA is part of the FDA is not a part of the NIH or the CDC, is its own standalone organization. But all of these organizations all fall under the Department of Health and Human Services, and that also includes Centers for Medicare and Medicaid. So, and also the Nurse Corps and all the and a bunch of other institutions as well. But they all fall under this banner organization of the Department of Health and Human Services, which is why FDA is important.
Yeah.
Especially when with especially with what Complex is doing with with cannabis and stuff like that. You know, this is where you get your approval for medications. If a medication does not pass the burden of a clinical trial before in as the FDA sees fit, those medications will not get approved for commercial use. And typically, to be honest, a medication only has to be roughly about 40% effective to be approved. So, you know, that's neither here nor there. But with that said, let's see what else they got right here. Because I'm not going to read into these cases because I'll be honest with you. I think the cases are a lot more than what's being reported. I think
Yeah.
very much the coronavirus is certainly the number of cases have certainly been underreported. That's certainly true.
Oh yeah, you hit that right in the head. See, when you saw these guys having to build an emergency hospitals, which what they slapped together in a few days just to handle that problem, the numbers are being highly undercounted, and in fact that problem's been going on there quite a bit longer than they wanted to admit. So no question about it. The undercounting of the numbers are I think are pretty big. I don't know what percentage that would be by, but I would have to say, man, they're probably way undercounted by at least 50%. I would say.
I think that's I think that's I think that's at minimum.
New York
Right.
City handling it? Nico?
Say that again.
How is New York City handling it? Are you seeing people walking around?
Well, there's a lot of panic. People are getting nervous. Even one of my friends, a former trader that I know, a Jewish guy, he's like, Carl, you got to be careful, man. You got to sit down. You got to make sure you got to buy a whole bottle of water and don't drink anything out of the faucet and don't do this and don't do that. And my God, we got to really protect ourselves. People here panicking. The stock market's getting hit. Everything else like that. People are starting to pull money out. They're starting to panic. Some people are starting to figure, well, this is a port city, if you will. So a lot of people will be coming into the airports and stuff like that. And you got LaGuardia and everything else like that up in here. So they figure that this is going to be a major transit point for some of this. So you have people who are kind of panicking. I don't want to get all deep into the panic. I say that we should be careful about what we're doing and kind of see where we're seeing more cases because we understand how pandemics move and see what we see starting to happen here in the United States. Keep a real close eye on it. I think the Chinese have done a decent job once they decided to get on top of this thing and close off a lot of travel and hospitalize a lot of people. But we have to see kind of where we are right now and see how we can contain it. But the scary thing I have to say about this disease is there's no cure for it at this stage. But as of right now, I think there's a lot of panic, a lot of angst. People are definitely nervous. Now I remember the whole SARS thing. And one of my neighbors actually, had adopted a Chinese baby, and people were actually kind of treating her like she was a pariah. Like, what are you doing? Adopting a Chinese baby, and what's wrong with you? And this kind of thing. There was a lot of racism involved in it as well, but there were some real issues. But nothing bigger came out of it. So I'm just saying, let's see if it's not overhyped. But I'm a little nervous because, we did see some cases that are starting to hit in some other places. I'm talking to my fiance down in Brazil as well, and a lot of stuff that's going on down there. If it hits that country and other places that have no ability to really handle that, I think we have a limited ability to handle that here. So there's a lot of fear, man. A lot of fear going on, as you can see, even in the markets. The markets have been hit. So people are trying to do what they can to somewhat protect themselves. But how do you really protect yourself against this? We really don't know. So there's a lot of ignorance out here right now as well. So, like one of my boys called me up to drink bottled water, man. Don't drink out of the faucets. I don't know.
Dr. Phoenix just talked about loading up on cases of water.
Yeah, I was talking earlier because I went to the store a couple of days ago, and where I'm at, there's like a Walmart and some local chain grocery store chains near me, and yeah, they're cleaning out. I mean, they're cleaning out water left and right. I mean, you go in the automotive aisle. I mean, people got the mask and everything. I don't know why the hell people buying those. You
The automotive, the AutoZone.
know? No, like in the Walmart near me, there's like, go over to the automotive aisle and they have some of those masks you can wear or whatever. People were buying those. People were, I mean, I think what's happening is that you do have this mass hysteria going on.
Yeah, you definitely have it. I get Poland Spring delivered to me. So
Yeah.
so I have that. So I already have that coming into the crib. But as far as people going to these stores and buying bottled water and stuff like that, yeah, that's going on. But yeah, you're right, Dr. Phoenix. You talk about the hysteria. There is hysteria out there. There definitely is. I can't lie about that.
Well, keep in mind too, in New York is one of the major entryways into the U.S.
Yeah, as you say, it's a major transit point.
Yeah. So remember when we started to see the first cases and the U.S. finally decided to get off their butts and do something about it, and they initiated these screening procedures at the 5 major airports in this country. So New York JFK was one of them, Chicago O'Hare, Atlanta Hartsfield Jackson, LAX. San Francisco, but it's ironic now because most of the cases we're seeing now tend to be more out west, so along that west coast, and for good reason because they're actually in closer proximity to the Asian countries than let's say New York or Chicago or something like that. But however, the initial screenings that they were doing, and I don't know if anyone saw videos of this because they were showing this about a month or so ago, where they were literally using like thermal cameras to see whether or not people had fevers or had certain hot spots on them. And it's just like, this is kind of silly.
Yeah.
This
The
is not going to
screening.
do anything.
Yeah, the screening for this is whack. So we really don't have a way of really putting a check on this right now. We just don't. And we don't have any type of real prophylaxis to really deal with this at this stage because we really don't know a lot about this virus from what we've seen. One of the key doctors who had really identified this thing was working with it died from this thing.
Yeah, the Chinese doctor.
The Chinese doctor, yeah. So I don't know.
Yeah. If you go down to Home Depot, you see guys with these I guess what you use for like spray paint. These masks, man. Got cats are just running around fronting real hard, man. It's not even Halloween, man. Guys got their mask on, man. What's going on?
Well, here's the problem: the mask that they're getting, unless you're getting the N95 mask, I mean, the mask to, I guess, to protect you if you're painting or whatever, it's not going to do you any good. I mean, it really not.
Why not?
Huh?
Why not? Yeah, it's on it. Right?
Look, I can tell you, Lowe's and Home Depot, the entire paint section, all the respirators are gone.
Unbelievable, man.
It's unbelievable, yeah. But I have to say, I think China really they kind of fucked up, man. They tried to keep this thing kind of quiet.
Yeah.
And said I suspect this thing was around a lot longer.
Oh yeah, absolutely.
You're hearing some people speak out on that, saying that they knew about this way before, and people have been dying. And you were right about that, Dr. Phoenix. They are definitely undercounting the numbers that have died there. They definitely are doing that. So they definitely have done that. So it gives people a reason to definitely panic. I can understand why there is panic out there. Like I said, it has hit the markets, the stock markets, and the trading markets, and so forth. Have gone down.
I think the simple fact that this has been enough to cause a pretty big disruption in the financial sector says a lot.
It definitely done that.
I mean, again, you've seen Apple come to a standstill. You obviously seen it with the auto industry. I
own Apple.
Yeah. You've seen it in a number of different industries where this virus has had a significant financial impact. And so again, again, this is not, of course, this is not the Spanish flu of the early 1900s.
Look at this. Look at this. What is this?
Oh shit. Oh,
what the hell is this name?
Is that
808.
a translator?
I don't know, man. People getting torn out the frame, man. Right in the YouTube space, man.
what's up?
Oh man, I had to turn
What the fuck? Oh shit.
I mean, and that's kind of, not to laugh or nothing like that, because I don't, I wouldn't want to do that, because I do think this needs to be taken serious. However, I just, again, folks really need to do their work and go to credible sources. If you're gonna, you're gonna do your own research in the background, trying to see how you can deal with this, really go to credible sources and do your work, man. Don't be listening to no folks with no goddamn 30 different names in their name, you know. I don't know, got like two different ways to call yourself black. I don't know. But
Yeah. I mean, I totally
yeah, but
agree.
but to get back to this article really quickly, I want to highlight this.
Oh my
You
god.
have you have what this is called, Remdesivir, developed by Gilead Sciences Incorporated, is an investigational broad spectrum antiviral treatment. It was previously tested in humans with the Ebola virus disease, and has shown promise in animal models for treating Middle East respiratory syndrome, that's MERS, and severe acute respiratory syndrome, SARS, which are caused by other coronaviruses. What needs to be understood about specifically Gilead is that Gilead also has another very popular antiviral treatment on the market that offers a 100% cure rate for hepatitis C. Something they just developed, only been on
Well,
about 3 years.
let's say this is let's say this is an RNA based virus, reverse transcriptase and all that kind of funky shit going on, which would be very difficult to knock out the box if you can't really properly identify it. Or maybe could this virus even be something that was weaponized and may have become a problem because it may have gotten natural in some way? I'm not saying that is the case, but let's say that this was something. What do we even have to deal with this? I mean, because these broad spectrums, some of these viruses and others just piss on some of this crap that they may have in some of these broad spectrum antibiotics. Now some of the stuff has been rendered not even rendered obsolete. So man, I mean, what are we looking at with this virus? What are we even looking at? It's,
and that's the $1 million question, brother. I think that's really the $1 million question. I don't think, I think we understand to a degree what we're dealing with, but what we're really dealing with, I don't think that's so clear. I don't think that's very clear at all. Because again, my thought process on it is that I think this is one of these viruses that's going to be something like almost a seasonal thing, like the cold or flu. That's my conjecture on it. I really see this being sort of more in a common rotation of seasonal illnesses that we see yearly.
I remember years ago they had the Hong Kong flu that hit and it took a lot of people out.
Hong Kong flu, that's interesting.
You remember that? That shit was back like in the 70s.
No, I gotta hear this one.
The Hong Kong flu, that shit tore folks out the frame. And I mean, it hit and it took out a few million people around the world. It was a pandemic that no one was prepared for. You just take a look at the Hong Kong flu. And so this is something that came literally, once again, out of China, out of Hong Kong, where it was supposed to originate, and it tore folks out of the framework. It was a pandemic that was terrifying. And people got a flu. They had it for about a week, didn't get rid of it. Next thing you know, folks were croaking. And old people and very young kids were dying from it. And it was taking a lot of people out. It took a tremendous bite on folks. So I'm just, I do know that these things can hit. Now, if this is a hype here, I don't know if it's a hype, but what makes me a little nervous is that, China built a couple of makeshift hospitals really quick.
I don't know if you heard earlier, Nego, but Mike and I was discussing that because again, I think the seriousness of this disease is not. I think at least as it pertains to Black people, I don't think Black people really understand just how serious this is. No, is it going to be a Spanish flu where you're taking out almost a third of the world's population? No, no, it's not going to be that. But it is something significant enough to bring certain industries to a standstill. And
Yeah,
if you consider that means that
yeah,
that means that for the most part, this is going to have a significant effect on everyone, everything, and every industry. I mean, there's nothing that has not been touched by this virus. And again, this is in a short period of time. Understand that this virus has killed more people in 2.5 months than SARS killed in over a year.
yeah. People were saying SARS was overblown. I thought it was as well. It turned out to
Yeah,
be
I think
exactly
SARS
that it
was
was.
overblown. But this virus, what makes this virus potentially deadlier is just how infective it is. It is a very infectious disease. I mean,
Yeah,
I
it
mean, there seems to
really
be
is.
multiple pathways through which you can get infected by this disease. And again, some of the
Yeah,
stuff I was discussing earlier, Nagon, if you didn't hear it, it was talking about like just some of the case studies that were coming out of China, where they're thinking that there's potential for aerolization of your feces, and that they're thinking that the coronavirus has been found to be in your feces, in your stools, and people using the bathroom. When you flush the toilet, it gets aerosolized, and they're thinking it might be able to travel through the air. Yeah, that was what
aerosolized from the.
yeah, we were talking. I was discussing that earlier, which is why Johnny Blaze and Complex we were talking about that, because I mean this is something that there seems to be a number of different ways that people have gotten it. And certainly we know for sure that people can get the virus from asymptomatic people. That's been proven through numerous cases now.
And and when you're asymptomatic, stepping around, that's dangerous. You don't even know you're carrying it.
Yeah, yeah. I mean, a lot of people on the continent, man, they have outhouses, so they don't really, you know, for those who live in these villages, man, they live in out. I mean, they use outhouses, so they don't necessarily have that part of the issue. But um, to that point,
Maybe.
man, maybe going back to old school living is probably the way to circumvent a lot of these things, man. Like he's saying, so.
Yeah, you got this article, brother. Did you want to bring up something from there?
Oh no, 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 no. It was just up.
Okay. Yeah, because I think, what needs to be said, there are clinical trials currently going on. I mean, in all honesty, I don't know if I put a whole lot of faith in that right now. You know, I mean, again, clinical trials take a while. You're
Yep.
gonna you're gonna need to recruit people, and so right now, at least right now, I would not put a lot of faith in that.
Well, Q497 in the chat has a question. He says, "Can the virus enter through the eyes?"
That is a good question.
Of course, the virus can enter through the eyes.
He's
Of
saying
course,
this. Can the virus that they're talking about, the coronavirus?
Well, I think anytime it comes in contact with any type of mucous membranes, there's
mucous
always
membranes or any kind of squamous epithelium. Wouldn't you agree, right?
yes, exactly.
Yeah.
Anytime you come in contact with that, there's always the potential for infection. So again, something that needs to be understood is that right now we're still sort of in the early stages of this virus. I think because every day you hear multiple stories about a new patient a new patient here, or some new development. But again, with that said, we're still very much still within the early phases of this virus. I don't even think we really hit sort of a midpoint yet, because now the US is just having to deal with it. Mm-hmm. And so understanding that the US is now just having to deal with the virus. In fact, I was told a story earlier today. I guess they're thinking that now you might have a high schooler that may have been infected with it. I want to say in the Seattle area.
Well, Seattle's got a lot of Chinese folks over there as well.
And if that's true, you know, if you get younger people develop this stuff spreads like crazy. You think about like something like meningitis, which is why folks who got college age kids, when you take them to their provider, they always tell them about getting the meningococcal vaccine, because again, you
Or,
think
or,
about being
or
in
think,
school or any type of environment like that. You got a high potential for an infectious agent to spread like wildfire.
or
Yeah.
think about something, or even think about with younger kids, something like Haemophilus influenza,
Yep.
which is very similar to or operates very similar to meningitis,
Mhm.
and that could be spread through younger kids. Suppose daycare centers or something else like that. Lord knows.
The thing is that what they found is that anybody under the age of puberty seems to be immune for this, or don't seem to have the same impact on them. They seem to be unscathed by it. Where
Yeah, and I'm not. They're not sure about it. I'm not sure about.
Well, let's see how long that. Okay,
I
I'm
don't know
sorry. I'm
why
sorry.
that is. I'm not even sure. I don't
Yeah,
think anybody knows.
and let's see if that's really the case, because that may seem this way, but it may not be that. So we don't really know. That's what I'm saying. That's why there's a lot of panic going on with this thing here right
I'm
now.
saying, based on the data that has been presented, because we have kind of a dashboard at work that's looking at all this type of stuff, and it seems to be the adults that are getting this. It's the men. A lot of men going men going their own way, getting it for real.
They going their own way, all right. They going their own way, all right, on this.
See,
Damn, you go your way.
Chinamen. They flew young.
But
yeah,
but right now the numbers here have been low. So I mean, regular flu every year kills people.
Yeah, regular flu
It
every year has
does.
been estimated. The regular influenza every year estimated to kill about 30 to 50,000 people yearly.
Yeah, that's a lot of fucking people. Damn, I didn't know it was that high, but
Yeah.
I know it does. I know it does kill a lot of folks. I wasn't up on the numbers on that, but wow. Yeah. So flu, just regular flu, has the ability of taking your ass on out of here. So could this be something else? I don't know. The only thing that makes me nervous is the Japanese response. The Chinese response to this thing and putting up those quick, fast makeshift hospitals in a matter of days.
Yeah, and it's interesting you said it, Nagone, because Mike and I earlier were talking about that, and I said that's very telling to really
Yeah.
the seriousness of the situation.
Yeah.
If they didn't have if there wasn't that many people infected, there would never have been a need for that.
That's exactly correct. And they built these makeshift hospitals fast.
Yeah,
they didn't build a Mass General. This is not Mass General or anything that they built, but they, these makeshift hospitals that you could put up very quickly, and just put patients in box rooms and literally have to do your care from there. They put that up very fast. So that let me know that they definitely perceive that there's a real problem here.
It seems that they had some kind of inclination of something was happening.
That's right. That's right.
And so it was a matter of the Chinese Center of Disease Control actually taking action and saying, hey, something needs to be done. But if you look at the lines for the hospitals, man, people waiting 10, 12 blocks just to get into the ER to see somebody. They had no other choice. There was no other choice to do that.
Yeah, I was actually looking at some of the videos earlier last month, and they were, some of the videos that were leaking out of China, because China, they went on like a whole, they clamped down on all that, because there were actually a lot of videos popping up about a month or so ago, and and China clamped down on all that, but there are videos showing where folks were saying that they more people were dying than were reported, where they were having to, they were cremating bodies, and so don't know how true that is, but certainly that was some stuff that I had saw in some videos. A lot of folks were saying there are a lot more people infected that were being reported. I mean, that's obvious truth from the numbers, because every day, you go to bed, you wake up, there's like you hear about 3,000 more cases.
Yeah.
The Chinese were definitely keeping this under wraps for a while. They tried to contain this thing in-house, not let anybody else know about it. They thought they could contain it in-house. They thought they could. For whatever reason, they're coming up now that they could not. And like I said, those makeshift hospitals that they came up with and slapped them bad boys together in a matter of days, that means there was a tremendous sense of urgency. That's problematic.
Well, keep in mind that the emergency management must have had some kind of preliminary plans in place.
Yeah.
In the event that something was to happen, that this is how a hospital will be built, and they had to put it to the test, right? And now that they've tested it, there's okay, we've done it in 12 days. Okay, fine. Well, next time something does happen, is how fast can we really get out there, right? So they're probably going to start. They're probably just collecting a lot of this information and saying, hey, we can actually this is how fast we can react. The amount of time we can react.
I think they were reacting to a problem. I don't think they were just kind of doing this to also see, well, how quickly can we do something? Because I think the Chinese know that they can put stuff together pretty quickly. I think they did this shit, man. I think they had their whole disaster game together. I think they had all this mapped out, and I think they saw a real problem. I think they responded. I think they responded even maybe they may have considered them. Maybe they may have even considered that they may have responded a bit late, because the way they got this thing together, man, they were moving fast. So, as I said, I think they felt that this was a problem, bro. That's what I believe in. Chinese, and there were a lot of Chinese people. So I think they were looking at this as a real problem. I think that they saw this as a real problem. And I think they're trying to do what they can to contain it. I think this thing was a bit bigger than they had anticipated. That's kind of what I'm thinking. I hope I'm wrong, but that's what I'm thinking.
Well, I think they had to keep it quiet, right, in order to stabilize the markets, because if that was to get out back in October that something was happening, you imagine it going to the rest of Q4 with destroyed markets or declining markets. It could destroy the economy overnight.
It is definitely going to hit their economy hard. Definitely going to hit them hard. All their securities, all their securities that they have, all their securitizations that they've got going down right now on these various markets, trading on in these various exchanges around, definitely going to get hit. There's no doubt they're gonna lose billions and potentially trillions of dollars behind something like this. So there's no doubt. I can understand the economic panic behind this. I definitely can see that. But if this thing is, just hopefully that this thing is not has gotten some level of containment on it. That's all. I don't know, because the bad thing about the markets is that you can really affect the market on just news. The news doesn't have to even be correct. Just on news alone, it can do a lot of damage. Mm-hmm. So it's very sensitive to that kind of stuff.
Yeah, it is. Plus, all the capitalization on mask and sterile gloves and foolishness. They had to open up a new factory just to produce masks.
But also too, keeping in line with what you're seeing happening in the markets, understand a lot of your medication, especially like your antibiotics, your opioids, come out of China.
Yeah, that's a fact.
They are a major
supplier
of your of pharmaceuticals to the world. Mm-hmm. And so, understanding that, the coronavirus has far-reaching implications than just sort of the physiological aspects of it. There is certainly the issues around supply and demand, industry, various industries, the pharmaceutical industry, the auto industry, the tech industry, and all of that. So, this has far-reaching consequences outside of just dealing with people's health. So, just something to put into perspective.
Yeah. This affects everything. This affects everything in the financial markets that we've already seen. It's wreaked havoc. Here the stock exchange has been down, 1,200 points or so. Which is not huge, considering where the market has been. We could actually look at maybe a little extra profit taken here, but I wouldn't worry. But if we start seeing things drop 4,000 and 5,000 points, then it's just going to be a real problem. But we're not there right as of yet. So, let's just keep our eye on it, fellas. I mean, it's good for us that we're talking about it, and I would like to get a better idea as to how we could potentially stop the spread of this if you can. There doesn't seem to be a lot of people who have a lot of good information on that. Panicking. Oh, look at man. Bottle of water, man. Don't drink out of the faucet, man. Calling up people panicking. It's like, whoa, shit. It's like, what? So, you got some folks here real nervous, man. Folks tired.
Again, I think the problem is that, for Black folks, because again, this topic is certainly about discussing its impact on Black people. The thing to keep in mind, because I know Black people are going to look for, alternative means of dealing with this. It is very important that you vet where you're getting your information from, because there's a lot of stuff going on right now. Because this is one of these situations where it's very easy to take advantage of people's hysteria,
absolutely,
lack of knowledge, and
absolutely
will put out a lot of information that is unproven, not true, and it can potentially do a lot of harm to people.
Yeah.
And so, if you're going to look,
facts.
If you're gonna look,
that's
yeah. If you're going,
go ahead, Doc.
Yeah, if you're gonna look at alternative means of staying healthy and dealing with this stuff, you need to go to verifiable sources. Go to people that know what the hell that they're talking about.
Absolutely.
Don't go to no dude with no damn kufi on and a kente cloth talking some crazy stuff.
And a kente cloth and an ankh.
You really need
I must totally agree.
You need to listen to you need to if you're gonna do this, go listen to folks that know what the hell that they're talking
about. What about keto diet? Can that help?
There's a lot of research that even shows that keto diets are bad, but that's neither here nor there. So
yeah.
But I would just say for Black folks, there's really one of the most important things you can do right now is just practice proper hand hygiene. Wash your hands. If you have children, teach your children how to wash their hands.
Yep.
And, children, they love to put their hands in their face, put everything they touch in their mouths, including their fingers, especially if they're young. But, if they're a little older, teenagers, again, they're doing what they're doing, and, you need to be very cognizant of what your children are doing. So make sure you're practicing proper hygiene. Don't want you to come home with infectious mononucleosis, also known as
this brother in the chat that said Dr. Hotel.
Dr. Hotel.
Oh man.
Yeah, but like I said, if I'm all for Black folks finding alternative means, but just be smart about it.
Yeah.
Because there's a lot of folks, especially right now, and certainly in this sector on YouTube, a lot of folks making videos talking a lot of crazy stuff. None of it has been reviewed. None of it is scientifically proven. None of it is.
Well, science is racist. Don't you remember?
Science is what?
They said that science is racist. The Earth is flat, and there's no such thing as space. The moon is a hologram.
Science is racist?
Yeah.
Man, come on. Oh, come on, man. Go ahead, man. Go ahead.
So, you know what? Last time I checked, Y equals MX plus B was universal in every language. So
Y equals MX plus B. Showing up, but
so Um, at the end of the day, certainly you can, you can certainly guide science in a particular direction. Well, not even science. You can certainly guide research in a particular direction. That's always true. But however, the outcomes cannot be disputed, and therein lies the key. If things are proven, if things are proven to work, that's how it is. Again, in my particular line of work, for what I do, you know, there's nothing you do that's not evidence based. There's nothing you do that has not been shown that you cannot find in the literature, and that's something to keep in mind. So, I know a lot of folks talk a lot of stuff. I know a lot of folks go do the Dr. Sebi thing, go do whatever. You know, do what you feel is best for you. Just be smart about it. But on top of being smart about it, make sure folks know what the hell they're talking about, because in this current age right now, you got Johnny Blaze talking about he's at Home Depot and Lowe's, and folks are buying up paint masks with filters that don't even filter out. Because that's the funny thing, because that actually reminded me, because I wanted to say something when he said that. You can go to Home Depot, buy one of these paint masks that has a filter. Those filters are designed specifically to filter out paint particles.
Yeah, this is not. It's not designed to filter out a virus, which could be much much smaller.
Yeah.
Which would fly right through those grates like somebody opened up the literally. I mean, from a science perspective, it could be like going into the Grand Canyon, man. It could be a big giant hole like that for real. I don't know,
man. Guys, I don't know. You saw it, but people walk around with big ass, fucking maxi pads on their faces and shit like that.
Oh shit, maxi pads on their grills. Oh my gosh.
Is there really stuff like that going on out there, brother?
Maxi pads on the grillage. Oh Lord.
Oh God, man.
Earlier, man.
Oh God.
No.
You didn't know it's super absorbent, man. It's absorbent.
Oh,
super absorbent. Oh, could you? I swear, if I saw a dude walking past me with a maxi pad, and said, I might be inclined to slap the back of his neck, my man. I'm like, what you got a rag on your grill, son? Oh no.
Oh
God. Rag on your grill. That's ill. That's ill. So that's crazy. But
it is gender neutral now, so.
Oh God.
That's ill. That's ill.
Like I said, if folks, folks do need to be taking their precautions, treat, in all honesty, treat everybody what we call standard precautions. Treat everybody as infectious, period. That's just how you need to look at it right now. Until this is truly under control, when you're out, you need to look at everyone as potentially infectious. We call that standard precaution in healthcare. And so, that's how you kind of need to look at it, but on top of that, again, situations like this where you kind of have this mass worldwide hysteria going on, so it's not quite pandemonium now, but it's getting there.
Yeah.
And certainly here in America, where you got God's guns and religion,
oh, yeah.
There's the propensity here to get violent. And you couple that with a disease that no one is not sure how to treat, although it's not necessarily 100% fatal, really has a small fatality rate, somewhere around 2 to 3%. But again, you're still dealing with a situation where there's a lot of unknowns here, and unknown creates panic. And you couple that in a country that has where its citizens have more guns than people with populations in other countries. It is a recipe for some truly for the potential for violence. I'll put it that way. But just keep in mind, for Black folks, understand that you need to be very careful where you get your information from. Vet your sources.
It's an excellent way to end this, man. Thank you.
Yeah.
This, man. Please hit the like button if you're not already done so. Thank you, Dr. Phoenix, for coming through with that knowledge.
I appreciate it, brother. Thank you all for having me on.
Yeah, Dr. Payne, good, man. Good to hear from you, brother.
Oh, pleasure.